Welcome to the American University of Antigua College of Medicine's Consortium of Universities for Global Health, or CUGH, satellite session. And as you know, today's session is entitled Reducing Childhood Obesity in Antigua and Barbuda in the Context of COVID-19 and Climate Change. Childhood obesity is increasing in prevalence all over the world, including in lower and middle income countries. Antigua and Barbuda, which is where we are beaming to you from, is no exception. At least most of us are in Antigua and Barbuda. Our content experts today and our medical students are all part of the Global Health Track at American University of Antigua. This elective track examines the health and vulnerabilities of various populations across the globe, and it gives these future physicians skill sets to improve health outcomes in the communities that they'll eventually serve. So here's the layout for today's session. Very shortly, we're going to first focus on childhood obesity in Antigua and Barbuda specifically, and then the following session will focus on physical activity. These are the first two of 6 major sessions. So the third session focuses on mental health, specifically of our children. The fourth will focus on climate change and its impact on the Twin Islands state of Antigua and Barbuda. Next, we have food systems and how Antigua and Barbuda feeds its residents, followed by the health economics of childhood obesity in Antigua and Barbuda and the financial influences. Now, to wrap all of this up, our future physicians, our students, are going to present solutions to address this complex, multi-layered problem. So to our audience, again, welcome. Thank you very much for being here. Just a little bit of housekeeping. I'll ask you to type your questions, please, in the Q&A section. All of the questions are going to be addressed at the end of the presentation. So please, as we go along through these different sections and something occurs to you, please type it in the chat and we will keep focus on that and address them, as I mentioned, at the end of the session. So we'll get going right away. I'll now invite Dr. Leslie Walwyn, who is a physician and Associate Dean of Global Health at AUA. In that session also will be Dr. Siobhan Bell-Jarvis, who is the Chief Pediatrician at the largest hospital here in Antigua and Barbuda, and she will speak to us on childhood obesity in Antigua and Barbuda. They will be assisted by Lillian Cassilis, who is a first-year medical student at AUA. Dr. Walwyn, over to you and welcome.
Thank you, everybody. Can everyone hear me?
Yes, we can.
Excellent. So hello, everyone. My team and I are going to be discussing childhood obesity in Antigua and Barbuda. But first of all, a little bit about us. Antigua and Barbuda is a twin island state, and we're a small island developing state in the Eastern Caribbean. Together, we comprise approximately 180 square miles, 2/3 of which is Antigua. 97% of our 100,000 people reside in Antigua. Our life expectancy is very similar, just 1 year shy of that in the United States. We have fairly good fertility rates and infant mortality rates, the latter actually being quite comparable with the United States. Our Human Development Index, which considers income, education, and standard of living, is considered to be high. Our gross domestic product ranks us by the World Bank as a high-income country. Our leading causes of death are cardiovascular diseases, cerebrovascular diseases, diabetes, hypertension, and cancers. In 2012, the Ministry of Health of Antigua and Barbuda estimated that approximately 25% of our adults were overweight or obese. Of course, females being greater than males. However, in 2016, an estimate on our country ranked that overweight or obesity was as high as 48%, with 55% of our females being overweight or obese, and that was by the World Obesity Federation. Government expenditure on health is 5.7% of our GDP, but the cost of obesity alone in 2016 was estimated to be $6.5 million US. And when we look at one particular complication of obesity, which is diabetes, the average per capita expenditure in 2016 on that disease was $767 US. So how did we get to where we are today? To see that, let's take a look at the people who have inhabited our Twin Islands. Prior to the arrival of the Europeans, the people who inhabited here were the Arawaks and the Tainos. Their diets were simple, comprising mostly of roots, including cassavas, yams, and sweet potatoes, and maize. And they also had our national fruit today, which is the Antiguan black pineapple and guava and other fruits. Their protein sources were from fishing and eating mammals that inhabited the land at that time. With the arrival of the Europeans and the increasing demand for sugar, this led to the eradication of the indigenous people due to disease and to stress because they could not work the lands. This led to the importation over time of thousands and thousands of African slaves into Antigua and Barbuda from West Africa. The diets of these slaves consisted of cornmeal porridge, which was often diluted, and salted cod or beef, all three of which were imported from other parts of the British Empire, particularly North America. This went on for centuries until emancipation in the 1830s. Prior to the 1830s, there was no choice but to eat what food was provided, as most of the land was occupied to use for sugarcane, and there was very little opportunity for slaves to grow their own food. Following emancipation, however, the people developed some form of self-agency and were then able to improve their diets by planting their own foods. This went on for just under a century, but by the 1920s, throughout the Caribbean region, there was marked social unrest because of extreme cases of undernutrition and malnutrition, poverty, poor hygiene, and many children dying from communicable diseases. Many homes were headed by single females who had to go out and work for their multiple children. This led to the development of the Moyne Commission to investigate the situation in the Caribbean, and following their evaluation, $1 million was pumped into the entire English-speaking Caribbean, and that led to a transition in standards of living within the same century. It also led to a transition of our dietary composition. People downed their tools, left agriculture, and moved towards the type of life that we live today. Antigua and Barbuda gained independence in 1981, but 5 years later, the CARICOM region recognized that obesity was already a health security threat to the region. So when you look at the food and nutrition history, when you look at Antiguans and Barbudans who are predominantly of African descent, West African descent in particular, you see that obesity is far more prevalent than our West African relatives who also came from the same stock. When you look at the prevalence of diabetes as well, it's also greater in our Caribbean people of African descent. Dietary changes that occurred over the century are due to multiple reasons. There's been a change in consumption patterns where from what we had when we were slaves or recently emancipated to a huge level of importation, to the point that we have far more carbohydrates than are required for our population's needs throughout the Caribbean. Far more proteins are consumed than necessary and far more fats. But when you compare with vegetables and fruits, there is marked underconsumption of this food group throughout the region, Antigua and Barbuda being no different. The types of foods that we eat, of course, have been influenced by, from as far back as the Arawaks, the slaves, and of course, the presence of Europeans. In 2009, the Food and Agricultural Organization worked with the Ministry of Health to assess and see what types of foods people who resided here were eating. And this became known as our traditional foods. A survey was done and a pictogram, as seen on the right part of the slide, was developed to help people learn and understand how we should portion out our foods, how much of our foods should be applied to use of carbohydrates, fats, fruits, etc. However, the pictogram wasn't able to advise on portion sizes. So when we look at the impact that sugarcane and slavery has had globally, you look at the United Kingdom and Europe and you realize that the amount of vast profit because of that great demand for sugar that came out of the sugar industry allowed for fueling of funding for great industrialization, which over time, of course, led to a rise in temperatures or contributed to it. And of course, a very wealthy Europe and United Kingdom and the United States. However, on our side in the Caribbean, there was marked underdevelopment because of the wealth extraction that occurred in these economies. And these colonies had very little infrastructure divested back into them from the profits of sugarcane, Of course, this led to inequities in access to proper nutrition. Imagine the centuries of poor access to the right amount of vitamins, the right amount of nutrients and calories, and even the right amount of minerals. There was also inadequate access to appropriate education until the second half of the last century, and of course also healthcare. So when you look at Antigua and Barbuda 100 years ago to today, back then we were an impoverished colony. Now we're a high-income country. Then we suffered from severe malnutrition and undernutrition of both children and adults. Now, too many of our children and adults have obesity as an issue. No longer are we suffering from communicable diseases, but we're living long and suffering from non-communicable diseases. We live in a very stable political system. 100 years ago and before, sugar, because of our history with sugar, was very important to us. We ate a lot of salted, preserved foods. And of course, rum was used to soothe the slaves because of their turmoil. Today, we still have a romantic relationship with sugar, salted foods, now also oily foods, and rum still is a part of our culture. That was life until 2 years ago. And added to that now, for the past 2 years, we have had COVID-19. In fact, it was March 2 years ago when the first case landed in Antigua and Barbuda. And like everywhere else, it had a huge impact on the nation. Because of the vulnerability due to the vast prevalence of non-communicable diseases, we knew that COVID-19 could seriously impact the population. Healthcare services had to be reorganized to make sure that they could protect the people against the threat of this virus. This impacted national health security, and our borders, like many other borders across the world, closed. That meant that tourism had to suffer, and tourism is our main source of earning our foreign exchange. So with tourism now being put on a shelf, household food security obviously suffered, since many people are part of the tourism industry and earn their income that way. So food security was threatened in the home. Thankfully though, Antigua and Barbuda has had a very robust vaccination program, and today boasts the best vaccination rates in the English-speaking Caribbean as CARICOM. But what about the impact of COVID-19 on our children? Like so many other countries, our schools closed and family dynamics changed, as there were many unemployed parents at home or working parents who had to be parents, teachers, and also employees at home. There was isolation from their peers, a lot of fear and anxiety, and even loss of loved ones. There were definitely changes in dietary habits. In some small cases, because there wasn't enough food at home. We know that poverty can actually, people who are living in poverty can actually have up to 50% of their income be apportioned towards making sure that there's food on the table. And of course, COVID-19 would have seriously impacted that. Additionally, there were changes in diets because the type of food had to be changed as to what they could afford to buy, or because of anxiety or fear or boredom, children soothe themselves by adding more calories to their diet. And anecdotally, throughout, multiple pediatricians on the islands have stated that there have been increases in BMIs in their children. This slide looks at the quality and quantity of food and whether or not hunger was occurring in the Caribbean. In a study done by Perry et al. Last year, there were some households in Antigua and the other islands that were studied that actually changed the quality of food because of the COVID-19 impact economically on us. And there was an increase in the prevalence of hunger in Antigua and Barbuda and all of the other islands that were studied. Let us now consider the factors that contribute to childhood obesity. Of course, the environmental factors are multiple. Individual factors include genetics and behavioral activity. And along with that, when we look at the obesogenic environment generally for all people, parents, of course, contribute to it significantly because parents feed their children. Breastfeeding is known to have a moderate effect and a protective effect against obesity later in life. Family culture and choices definitely make a difference, and education of the family and income of the family also impact whether or not a child may become obese. Poverty is known to impact the likelihood of developing obesity, especially if there's lack of availability of food in the early years. Later on, we know that it can be associated with obesity. And an obesogenic environment is definitely stimulated by the presence that we have in the Caribbean of ultra-processed foods and drinks. They're affordable, easy to prepare, very easy to consume. They're aggressively marketed, of very poor nutritional value, but high in caloric content. They definitely promote obesity, and they generate waste and therefore contribute to pollution. So what about our children in Antigua and Barbuda? The children and adolescents comprise approximately 30% of our total population. We know that our breastfeeding practices are not up to par, where less than 50% of our babies are exclusively breastfed for the first 6 months of life. We boast a literacy rate of 99%, and on average, our children spend at least 10 years in the formal education system. Unfortunately, 25% of our children live in poverty, and we know that there is extreme poverty being doubled in female-headed households. And that likelihood of being in extreme poverty is likely to increase sixfold because of the COVID-19 pandemic. When we look at physical activity, less than 32% of our children between the ages of 13 and 15 in a study actually participated in physical activity of 1 hour or more per day. Far less activity in females. And when we look at the consumption of daily sugar-sweetened beverages, nearly 60% of children consumed it daily in the same age group. Regardless of gender, 45% of our children had had an alcoholic beverage in the past year.
Thanks, Dr. Walwyn. So the data on childhood overweight and obesity in Antigua and Barbuda was analyzed for 3 cohorts, starting with data from 2006 to 2009. And the guidelines used to analyze this data were the CDC guidelines. Now, the CDC defines children living with overweight and obesity as those who fall anywhere from the 85th percentile of weight or greater. It was found that 26.4% of children and adolescents between the ages of 5 and 20 were living with this condition here in Antigua and Barbuda. When the data was eventually analyzed for the 2017 cohort, based on the data obtained from the Ministry of Health, it was found that the prevalence of overweight or obesity had increased to 31.8% by the same CDC guidelines for children and adolescents between the ages of 11 and 18. An additional analysis of the data was conducted on the 2018 cohort from the CRUISE dataset, which is the Caribbean Island Urinary Iodine Survey, using both the WHO and the CDC reference ranges for children between the ages of 5 to 11. And the WHO, it was found the prevalence to be 37.6%, and using the CDC guidelines, 30.6%. Now, historically, the CDC guidelines have tended to underestimate the prevalence of overweight or obesity in a population. So this tells us that at least a third of our children and adolescents, probably greater, are living with overweight obesity. So we can see here on our next slide that we've categorized children by age, with our blue bars representing the normal or underweight category, and the orange bars representing those affected by overweight or obesity. We were able to compare the data from 2006 to 2009 with the more recent 2018 data. And in the first cohort, we see an observable but not statistically significant increase in the rates of overweight or obesity. Now, here on our next slide, we see the 2006 to 2009 data once again on the left, compared to the 2017 data, where we see a highly statistically significant increase in the adolescent data. So as you can see, overall, child and adolescent overweight and obesity are on the rise in Antigua and Barbuda. Next, we looked at the childhood obesity data from the lens of both age and sex in the percentage of adolescents living with overweight or obesity. So the blue bars in this case represent prevalence in males, and the red bars represent the prevalence in females. And based on our adolescent data from 2017, being adolescent and female puts you at a highly significantly greater risk for suffering from overweight or obesity. So a chi-squared analysis was conducted using the 2006 to 9 data, which showed a statistically significant increase in the risk of childhood obesity. And when logic regression analysis was performed on the 2017 data, it was found that being female and having higher systolic blood pressure was associated with being overweight or obese. By linear regression analysis, it was found that being older, male, and overweight or obese was associated with higher systolic blood pressures. And finally, that being older and overweight, regardless of sex, was associated with higher diastolic blood pressure. So as you can see, regardless of the statistical analysis, the results were significant in their findings. So finally, looking at acanthosis nigricans, this is a skin condition that causes a dark discoloration in body folds and creases. And it serves as a pretty good indicator of insulin resistance in children. Based on the data from 2006 to 2009, the rate of acanthosis nigricans in children falling within the normal or underweight categories was only 5.6%, while the rate was 44.6% comparatively in those living with overweight or obesity. These provided significant findings linking overweight or obesity to the likelihood of not only developing this condition, which is an indicator of insulin resistance, but also the potential risk for diabetes in the future.
Thank you. So these are our references, and we'll now allow Dr. Siobhan Bell-Jarvis to join us. And I'll stop sharing my screen.
Thank you so much. I invite you at this time to take a walk with me in the portals of your mind and envision a bomb before you, a bomb that has been lit and is about to explode. I'm sure you can see yourself frantically trying to out this bomb. Believe it or not, childhood obesity is a ticking time bomb. And President Barack Obama had it right. For the first time in human history, he said, children have a lower life expectancy than their parents. Our objective must therefore be to resolve this problem within a generation in order to ensure that those children being born today reach adulthood at a normal weight. And so we can recognize that childhood obesity is a public health crisis of pandemic proportions. Just looking at those who are less than 5 years old, 41 million children globally are overweight or obese. By 2050, 25% of children will be affected by obesity. But guess what? We have already surpassed this percentage in Antigua and Barbuda. We recognize that over 70% of children under 5, children 5 to 19 years, and adults who are over the age of 20 are either overweight or obese. But take a look at the high-income countries. As you progress in age, the percentage of those who are overweight or obese gradually increases from 11 to 25%. I remind you that Antigua and Barbuda falls among the high-income countries. Now, in order for us to appropriately tackle childhood obesity, we have to recognize the factors that affect it, whether it be indirect or direct. Most of us are aware of the direct factors: diet, early life nutrition and genetics, physical activity. But let us not underestimate the indirect factors: the country's wealth, urbanization, the built-up environment, social and cultural norms, technology, trade liberalization, which is very important, and food systems. But what about the impact of childhood obesity, not only on the child or family, but on the nation and even world as a whole? They're both indirect and direct impacts. Now, when we think of the direct impact, we're looking at medical complications as well as direct costs for both outpatient and inpatient services. Let's take a look at the medical complications very briefly. Medical complications can affect every system. Neurologically, pseudotumor cerebri, risk of stroke. We can't separate the psychosocial aspects from the neurological aspects. The risk of poor self-esteem, depression, a decreased or reduced quality of life due to bullying, cardiovascular system, dyslipidemia, hypertension, left ventricular hypertrophy, chronic inflammation, the risk of type 2 diabetes in the endocrine system, precocious puberty, polycystic ovarian syndrome, risk of stress incontinence, musculoskeletally, the risk of fractures, Blount's disease, slipped capital femoral epiphysis, flat feet, and the complications can go on. But what about the indirect impact of childhood obesity? The economic costs, higher life insurance premiums, low wages and household income. When we look at the productivity costs, absenteeism, and even presenteeism, these are not limited to the workplace, but can be extended to the school environment. Being present in the classroom, but really not being able to focus and produce as much as is expected based on developmental age. The risk of premature death and disability continues to be a significant factor. And now I project this graphic. We are, of course, cognizant of people first language. So I said we'd like to use the terms children affected by obesity, adolescents with obesity, adults with obesity, and older adults with obesity. We recognize that children with obesity will progress to being adolescents with obesity, then adults with obesity, and then older adults with obesity. The individual is affected, the family, the community through skill development, income, career opportunities. There is an intergenerational impact and catastrophic healthcare expenditure. We recognize for the economy that national savings and investments are affected. Likewise, the environment, which we'll discuss later on. The government will have significant expenditure, disability payments, public pension, and tax-based payments. And when we look at the employer industry, productivity, healthcare payments, disability, and pension payments all come to the fore. Now I draw your attention to the UK experience. Obesity for them cost the wider society £27 billion. The National Health Service spent an estimated £6.1 billion on overweight and obesity-related ill health in 2014 and 2015. This was more for each service in terms of the police, fire service, and judicial system combined than what was spent. What was spent on obesity, was more than that which was spent for the police, fire service, and judicial system combined. Now let us look at the global picture. In the United States of America in 2018, the costs associated with chronic diseases, secondary to obesity and being overweight, US dollars 1.72 trillion. The Republic of Ireland in 2009, direct costs, 865 million euros for the indirect cost and 437 million euros for the direct cost. In Germany, 2015, the direct cost, 8.6 million. Direct cost in China, 24 billion. Canada, US dollars, 1.5 million. And in Europe, both direct and indirect costs, 41 billion per year. The costs, I know that you would agree with me, are astronomical. Now we look at the impact of COVID as I begin to close. COVID has led to deteriorating psychosocial health, increased socioeconomic hardship, chronic stress, altered eating behavior, and a perturbed energy homeostasis, which has led to worsened obesity. But I want to draw your attention to the fact that any global crisis can do this. It is not limited to COVID-19. And therefore, the time to act is now. We're not limited by a special day of awareness, but rather everybody needs to consistently act as we strive to appropriately address the pandemic of obesity. Thank you.
Thank you very much, Dr. Bell Jarvis, and to all of our presenters in that first section. Thank you for such an eye-opening start to today's session. And I'll just like to remind the audience again, if you have any questions along the way, please place them in the Q&A. All right, so we'll move on. And I'll now invite Ms. Danielle Walwyn, who has a Master's of Science in Health Promotion and who is also a certified fitness instructor. She will be speaking on physical activity in Antigua and Barbuda. And she will be assisted by first-year AUA medical students, Najwa Isaac and Jasnoa Dillon. Over to you.
Thank you, Ms. James, and hello, everyone. It's my pleasure to talk about something that myself and the students are very, very passionate about, physical activity and this role that it can play in the solution to childhood obesity. Apologies. Alrighty, so starting us off, 80%. 80% of the world's children and adolescents are not achieving the World Health Organization's physical activity recommendation of 60 minutes or more of physical activity a day. Unfortunately, a large portion of our children and adolescents in Antigua and Barbuda are also not meeting this guideline. And if you think about it, this means that a large portion of our children and adolescents are not benefiting from the mental, social, and physical benefits of physical activity, which we know can put them at risk for childhood obesity, as mentioned previously, and developing non-communicable diseases. The part of physical inactivity, or what is really contributing to the levels of physical inactivity, is a lack of investment globally. And we really, really do need to put a greater investment into physical activity and creating spaces where it is easy to be healthy. Physical activity can be a solution to a healthier child and a healthier environment. It can bring us closer to achieving the UN Sustainable Development Goals, and it can really improve a population's mental and physical health. It can tackle gender equality, and it can tackle the climate crisis. And it can do this in Antigua and Barbuda too. What we need is a multi-sectoral, all hands on deck approach. And so with this, I'm actually going to turn it over to Jas Noor, who's going to tell us a bit about the physical activity context in Antigua and Barbuda with regards to the statistics. We're then going to delve into a greater understanding and exploration of what's happening with physical activity in Antigua, and also start talking about some solutions. Jas Noor, over to you.
Thank you, Danielle. So in terms of physical activity in Antigua and Barbuda, it was shown that 32% of adolescents are active for at least 1 hour a day. The most popular activities include playing sports, riding bikes, walking, and going to the gym. Based on the data provided, there was a positive correlation between an increasing age, walking, and going to the gym. Of the 80% of those who were active took part in one of the activities listed. Like many other countries worldwide, Latin American and Caribbean countries utilize active transportation to and from school. Active transportation is defined as any human-powered, self-propelled means of transportation, such as walking or bicycling. According to the data, 41.9% of students between the ages of 11 to 18 reported active transportation to and from school at least 3 days out of the week. Antigua reported only having 35% of active transportation. In both studies, females had a higher percentage of utilizing active means of transportation. In comparison to Trinidad and Tobago, Anguilla, St. Kitts and Nevis, Antigua had a greater percentage of adolescents that were physically active for at least 1 hour a day. Across all other countries, girls were more likely to spend 3 or more hours per day sitting. Females being less active can be due to a variety of factors, including children's exposure to narrow gender norms on boys versus girls. Along with this, many women are discouraged from certain physical activities due to preconceptions, social physique anxiety, and socio-cultural barriers. Despite these factors, women continue to take the lead in childcare and household management, often in addition to paid work. Due to technological advancements, lifestyles have become more demanding for women, allowing them to be less physically active. In terms of the general public, people tend to have their own personal reasons for why they're inactive, but a vast majority of them revolve around time, energy, and lack of motivation.
Thank you, Jas Noor. So I also want to point out here, Jas Noor, the data he presented, that was pre-COVID. And unfortunately, that's all the data that we have. So there definitely is a lack. But we know, although we don't have the data to show it anecdotally, there was a significant decline in physical activity, particularly due to the lack of, or the closures of schools, as well as the suspension of recreational opportunities. And we know that the amount of sedentary time increased significantly over the course of the pandemic. One thing that I don't think we pay enough attention to, and I'm hoping post this seminar we will, is the impact of climate change on health in general. And it does have an impact on physical activity as well. Natural disasters have destroyed sports facilities in Antigua and Barbuda. Weather changes, including sporadic rainfalls, excessive winds, increases and decreases in temperature also act as barriers to physical activity. The drought that we've experienced, which I know my colleagues will expand upon, has affected the irrigation system of a lot of our sports fields, which has resulted in cracks in the soil, making them unsafe for use. We also have sea levels rising and coastal erosion, which can impact water-based activities. So interventions on climate change can impact physical activity in both the short and long term. And so it's very important for us as we're thinking about solutions that we keep these synergies in mind when we're thinking about how we can make our Antigua, our people, healthier. And so with that, we're going to delve a bit into the physical activity context of Antigua and Barbuda, because we're talking about interventions and solutions, but we really need to understand what is happening. So firstly, we're going to talk about the culture around physical activity. We're then going to delve into the physical environment, the spaces and places to be active. And then we're going to talk about the policy environment. Okay. So with that, the physical activity culture. So when I did my physical activity research in secondary schools in Antigua, I asked the students to define physical activity for me. Almost all the students related physical activity to sport. We are very, very sports centered, and this has filtered into our PE curriculum as well as our extracurricular offerings. And being sports-centered is great if we want to shape an athlete, but we really do want physical activity to be a part of all of our lives, not just those of athletes. And so it's very important that we make physical activity, a variety of them, accessible to all so that we can really develop positive associations with physical activity. It's important that we have walking clubs, yoga clubs, hiking clubs available for those, especially those who don't like competitive sport, including and especially girls. I was really pleased, though, I have to say, that over the COVID-19 pandemic, there was a shift towards a particular activity, hiking. It was one of those activities where we were allowed, just given the COVID-19 pandemic and limitations, because it was outside. So we were allowed to interact socially. And this was really important. And I think this is a lesson learned that we need to step away and really explore the co-benefits of physical activity. With hiking, we had the mental, social, and physical benefits. Another important aspect of our culture when we're talking about students is a high focus on academics, especially for the school-age children. And don't get me wrong, we know that academics are important. However, we can't outweigh the benefits of physical activity, the physical, mental, and social benefits. And this issue was really brought to light during my research work, where I learned that parents would often take their students out of physical activity related activities, and they would put them in homework and extra lessons. We need to put this into perspective, because if you have a student who's at the top of their class, but their health is at risk, it's just not worth it. And so with that, I'm going to turn it over to Najwa, who's going to tell us a little bit more about the physical environment, the spaces and places to do physical activity. Najwa, over to you.
Thank you, Danielle. There are many public facilities and spaces in Antigua and Barbuda designated and adapted for physical activities across all communities. While these spaces have numerous advantages, some present a number of challenges and barriers to participation. Physical activity has a great impact on individuals' health, and access to physical activity spaces plays a significant role in this. In Antigua, each village has a physical activity space that is open to its villagers. Our slide shows one of these spaces, the Cedar Grove Village, which also serves the island's northern neighboring communities. The facility, which is adjacent to the Cedar Grove Primary School and is near to other schools, includes a dedicated basketball, tennis, and netball court, as well as a small playground for small children. We visited 2 facilities in St. John's, the Asco Sports Complex and the YMCA, both of which are within walking distance from several elementary and secondary schools. The Asco Sports Complex is primarily for athletic activities and includes a small gym. The facility was recently renovated and now hosts many schools' annual sports day activities. However, we noticed some sunken areas and thorny bushes in the green spaces, and access to the facility tends to be restricted. The YMCA offers competitive group sports such as basketball, netball, volleyball, as well as aerobic classes at certain times of the year. As with these examples, other physical activity spaces and facilities offer numerous benefits, but are in despair. Transportation and road safety is a major concern due to lack or poor condition of sidewalks leading to these facilities. Also, while cycling is one of the more popular physical activities in Antigua, cycling lanes are uncommon. Implementing these lanes would greatly facilitate active transportation. Other issues include uneven crack surfaces, unmanicured fields, lack of proper sporting equipment, lack of supervision for small children, and inadequate infrastructure, including lack of perimeter fencing, lighting, restrooms, changing rooms, etc. However, better managed facilities limit or restrict user access. Furthermore, with global temperatures rising, the demand for indoor physical activity spaces far exceeds the island's supply. Even though certain spaces are not necessarily designed for physical activity, they have been adapted for this purpose. A prime example is the Sir Vivian Richards Stadium. Aerobic classes are held in parking lots, while walking and jogging are permitted on the green spaces and perimeter roads surrounding the facility. Additionally, our beaches serve as prime locations for activities such as swimming, walking, and sports. Some of the other barriers to physical activity are gender specific, as women struggle to find non-competitive and non-sports-based physical activity spaces for activities such as aerobics and dance. Female-dominated sports grounds may be few in number and often receive less infrastructural development and upkeep than male-dominated sports grounds. Also, women might find it challenging to find safe spaces to engage in physical activity without fear of harassment. Back to you, Danielle.
Thank you, Najwa. So you really gave us a good overview of the spaces and places where we can be active, including our children. And another critical element that may facilitate or hinder physical activity is the policy environment. Are there policies in place that will help to make physical activity easy and convenient, especially for children? Well, the Antigua and Barbuda government signed the Port of Spain Declaration that encouraged governments to mandate physical education. And schools in Antigua offer PE, which is great. However, not all schools are compliant with the mandatory requirement. Oftentimes, PE is offered once a week in some schools. Further, Antigua and Barbuda does not have a comprehensive school health policy that addresses the mental, physical activity and nutrition needs of children. A policy like this really could encourage the integration of physical activity throughout the school day, including movement breaks in non-PE classes, because we can't just depend on PE, as well as ensure that physical education is mandatory. And as you would have seen from Najwa's presentation, we have many spaces and places for physical activity. However, none of these spaces have user or governance policies that would mandate regular maintenance and caution against harassment and bullying that Najwa mentioned. And so these sort of policies are critical for addressing some of the major issues related to physical activity and ultimately helping to make physical activity fun and safe. So some overarching solutions as we think about moving towards a more active society and a healthier society. Using a rights-based approach. Children have a right to the highest attainable standard of health. And Antigua and Barbuda has signed the UN Convention on the Rights of the Child, and they have a duty to ensure that children attain the highest attainable standard of health. We really need to put a mechanism in place that allows for multi-sectoral thinking about health issues like physical activity. So you have a climate expert, physical activity expert, a mental expert, all in the same room. And this will really help to act on synergies. We also need to increase funding and research. As I mentioned, the research we presented today, unfortunately, that's all we have for Antigua and Barbuda. And lastly, use resources. So the WHO has this active technical toolkit. And so I just want to end on this. We need to invest in active societies. We need to shift the narrative of physical activity and appreciate the co-benefits. We need to invest in active environments, more spaces and places for people to be active. We need to invest in active people, ensuring that there are opportunities for all, including and especially those who are least active, like girls and persons living with disabilities. And we need to invest in active systems, governing systems with health champions who put health above all. And lastly, we are talking about children here. They should be the center of all of our efforts, and they should have a space in co-creating this healthy environment that we're talking about. Thank you so much. Over to you, Dr. James.
Thank you so very much, Danielle and Jasnoor and Najwa. As the day gets started today, I was so excited to get going with this topic that I forgot something very basic. So I'd just like to introduce myself. My name is Karen James. I am an associate professor here at the American University of Antigua College of Medicine. I'm very pleased to be supporting Dr. Warwin today by co-hosting. And as you know, Dr. Warwin, who was our first speaker, is the tour de force behind this symposium. Okay, so with that, let's move on. I'd like to welcome Dr. Joanne Brathwaite, excuse me, who is a community-based psychiatrist in Barbados, another small island developing state that is a close neighbor to Antigua and Barbuda. She also has a Master of Public Health degree, and she will be addressing mental health and will be assisted by first-year medical student Asta Jane, and also a second-year student, Renal Sharma. Over to you.
Good afternoon. Thank you very much for that kind introduction. I'm going to just start sharing my slides now. Now, today, our job is to take you through the mental health impact of what we see as the childhood obesity, NCD, and climate change pandemics, and how COVID-19 has affected those. So why are we even talking about mental health? Well, right now, mental disorders are the 5th leading cause of disability-adjusted life years, as well as years lived with disability. And even before the COVID-19 pandemic, there was an expected tripling of the economic burden that's associated with mental disorders by the year 2030. Mental health is fundamental to the way that we interact with our internal and external environments. And as the first Director General of the World Health Organization, Brock Chisholm, would have said, without mental health, there can be no true physical health. So on that background, let's talk a little bit about childhood obesity and mental health. Mernal?
Dr. Brathwaite, could we have our slides up to begin with?
Yes, your slide is up. You're not seeing it?
No, the slides are not up yet.
So sorry. Please go ahead.
All right, so as mentioned earlier by our colleagues and professors, fast food consumption was already on the rise before COVID-19 began, especially in young adults from low to middle income countries. So consumers of fast food already have a higher intake of saturated fats, sugars, and sodium with an overall low nutritional value of their foods. And this results in a rise in obesity, insulin resistance, and elevated total cholesterol intake, which negatively impacts the children's mental health, leading to higher rates of depression and suicide attempts. Consequently, this is further exacerbated with food insecurity. And in 2009, a survey conducted amongst children from the ages 12 to 15 years of age indicated that in their age group, 56.6% of individuals indulged in fast food consumption in Antigua and Barbuda. And of those children, 7.2% of individuals experienced food insecurity. And a similar survey was conducted in Barbados with the same population demographics as Antigua and Barbuda. And this showed the obesity rates in children based on their gender. And this study noted that 31% of boys and about 15% of girls were obese in Barbados.
Now, when we talk about the mental health fallout of childhood obesity, we've heard quite a bit about the physical impact. But what we know is that boys and girls who are living overweight or with obesity have a greater risk of developing depressive disorders as well as anxiety disorders. And with increasing weight, the risk of depression and anxiety increase. Girls are overrepresented in this group as well. And these children are at much higher risk of having poor school performance, poor social outcomes, and they're also at risk of being teased and bullied because, like mental illness, overweight and obesity are associated with significant stigma. And the health of adolescents and the mental health of adolescents, that time is particularly precarious. And Asta is going to share with us why.
So unfortunately, adolescents tend to be more vulnerable to mental health problems like depression and anxiety. This is because many of them are in a time of their lives where they experience a lot of change all at once. They experience puberty and the physical and emotional changes that come along with it, changes in friends, changes in family dynamics, and changes in social and self-perception. So much change all at once can be very stressful for many teenagers. This can put them at a significant risk for feeling more isolated, anxious, and depressed. Additionally, poor mental health can also result in suicidal ideation. When it comes to adolescents in Antigua and Barbuda, teenage girls were reported to be 6% more likely to consider suicide than boys of their age. These numbers indicate that there is cause for concern and change. Next, please. So coming to bullying, many adolescents are very unsure of themselves and the world around them, which makes them easy targets for bullying. In fact, recent data shows that 25% of adolescents in Antigua and Barbuda are subject to peer bullying. Teenagers who are obese or overweight are at an even greater risk for bullying because they may be judged harshly for their appearance. This may include physical violence, name-calling, and exclusion from group activities like sports. Bullying can not only damage self-esteem, but can also increase feelings of isolation, predisposing victims to mental illnesses like depression and anxiety. Next, please. According to UNICEF, 33% of adolescents in Antigua and Barbuda do not feel understood by their parents, and 6% of teen girls, compared to 11% of teen boys, say that they do not have any close friends. Individuals who do not feel loved and supported by the people around them may resort to unhealthy coping mechanisms such as overeating. They may also feel the need to eat certain unhealthier foods in order to fit in with their peer group. In the long term, these eating habits can result in significant weight gain. Children who are obese and mentally ill may be further stigmatized and isolated due to their appearance and low self-esteem, clearly perpetuating an endless and damaging cycle. Many children who are suffering from mental illnesses may find it nearly impossible to engage in physical and social activities, making it more likely that they continue the sedentary and unhealthy lifestyle. Hence, the lack of emotional support may be a contributing factor to the rising prevalence of childhood obesity in Antigua and Barbuda.
Thank you, Asa. And we know that children who are overweight or living with obesity tend to go on to be obese or overweight in adulthood, and that leads to an increase in NCDs. As we've heard, a sedentary lifestyle is a significant risk factor for physical ill health, but we'll see that it is also linked to mental health. Mernal?
As mentioned earlier, before COVID-19 began, sedentary behavior in our normal day-to-day lives was already on the rise. And in children, sedentary behavior is positively correlated with a higher risk of chronic non-communicable diseases. And the Global Health Observatory reports that by 2016 in Antigua and Barbuda, 9.2% of the children from ages 11 to 17 were not meeting the WHO recommended guidelines for physical activity in Antigua and Barbuda. And consequently, in the age group of 10 to 19 years of age, NCDs are the second leading cause of death in children from Antigua and Barbuda. Over to you.
Thank you. Now, when we talk about NCDs and mental health, the point has to be made that mental, neurological, and substance use disorders are NCDs, but they tend not to receive the priority or attention that the physical NCDs will. But the two are closely linked. They're linked through risk factors, such as we've heard, sedentary behavior, harmful use of alcohol, or eating habits, but they're also linked through comorbidity because the physical NCDs and the mental NCDs are highly comorbid. So for example, type 2 diabetes is associated with a twofold risk of depression. 1 in 2 cancer patients are likely to have a comorbid mental disorder, either anxiety or depression. And we know that when comorbidity exists, the burden of disease for the sufferer is in fact much greater, and their prognosis is much poorer. So let's talk a little bit about climate change and mental health. The link is not immediately apparent, but this infographic just shows that when we look at the burden of disease imposed on human health by climate change, we can see that there is in fact a contribution from mental health, because the climate crisis is in fact a global public health challenge. And when we look at the literature, it shows us that it's not just acute climate crises or acute climate events such as wildfires or flooding, but also the chronic climate disruptions such as rising sea levels, rising temperatures, or water scarcity. They all actually result in increases in different types of psychopathology, including anxiety and depression, including post-traumatic stress and even suicide in affected populations. And when we look at vulnerable groups, we know that children are especially vulnerable, not only because of the factors associated with adolescence that we've heard about, but because of the fact that just by virtue of their age, they're expected to be exposed to the climate crisis for a longer period than adults are. And they are actually the group that is least likely to be able to adapt and change at this time. And again, the children who are poor, children who are from developing states, such as Antigua and Barbuda, they are actually at greater risk for having adverse mental health outcomes. And this infographic just shows that there is a significant intersection between physical, mental, and community health fallout from climate change. But I do still have to make the point that, as we've seen, physical health is linked to mental health. So the physical health burden also increases the mental health burden. And because mental disorder at the level of the individual impacts the community and vice versa, when there is community dysfunction, then the mental health burden of the individual is going to be increased and vice versa. Now, I also have to make the point that even before COVID-19, there was significant unmet mental health care need, so that we've got 800 million persons approximately worldwide living with a mental disorder. And if you add the substance use disorders, that number jumps to 970 million. But in the low and middle income countries, up to 85% of persons who had a mental disorder were not receiving any treatment for that disorder. And even in the high income countries where there are resources, that could still be as high as 50%. So even in countries with resources, the mental health outcomes were not good enough. And then we added COVID-19 to the picture. And we put it to you that the COVID-19 pandemic would have had a catalytic effect on the mental health fallout. And again, the vulnerable groups, children, and especially children of the small island developing states like Antigua Barbuda would be a most vulnerable subgroup. So let's talk briefly about COVID-19 and mental health. Now, this is not by any means an exhaustive list, but the entire population of the globe would have experienced some degree of fear and anxiety related to COVID-19. when the mitigation measures for COVID-19 were put in place, persons would have experienced some degree of isolation. There would have been loss of income. Those who lost loved ones would have experienced bereavement. We had increases in the use and harmful use of alcohol and other drugs. And as recently as the 18th of this month, the Journal of the American Medical Association informed that not just use, but deaths associated with alcohol and its harmful use increased during the pandemic. There were the effects of the disease itself on mental health in the form of delirium and stroke. And we know that persons who had a pre-existing mental, neurological, or substance use disorder had a greater vulnerability to actual COVID-19 infection. And then there were disruptions in mental health service provision. And as we've seen, there was already significant unmet mental health care need. So any level of disruption in the already low level of services would have had a tremendous impact. But we also have to look at the children. Issa?
Yep. So coming to how COVID affected childhood mental health. So in a study when around 8,500 youngsters were asked to account for their feelings during the first months of the pandemic, the data revealed that 43% of females and 31% of males said that they felt pessimistic about the future. The general COVID situation has greatly impacted the daily lives of many young people, as 46% report having less motivation to do the activities that they previously enjoyed, and 36% feel less motivated to do regular chores. The lives of many families were also drastically impacted by the pandemic, predominantly due to social isolation, uncertainty, frustration, boredom, and the financial loss that followed. These circumstances can be especially troubling for impressionable children who need the support and stability of the peers and teachers and their parents in order to flourish. Consequently, the pandemic's negative effects on social bonding and human interaction have served to increase the incidence of mental health challenges in children and adolescents. Thank you.
Thank you. So let's look at what COVID-19 would have added to the existing problem of mental disorder associated with childhood obesity.
So biologically speaking, due to COVID-19, there was an increased level of stress-induced inflammation and stress-induced immune response, which exacerbated the childhood obesity. And socially, due to the food insecurity worsened with COVID-19, there was a huge spike in the general screen time and sedentary behavior of the entire world's population. With the induced stress of COVID-19, there was an increased caloric consumption while individuals remained at home during lockdowns. And then we come to the psychological part where there was more anxiety revolving around the whole topic of COVID-19, the mental distress that came along with it, and sleep pattern changes, which can all be related to risk factors for childhood obesity.
Thank you. So as Mrinal would have shared, basically what COVID-19 would have done would have been to either worsen or in some cases create both an internal and an external obesogenic environment that would have actually adversely impacted and increased the already high rates of childhood obesity that we've been hearing about. And once you have an adverse impact on the rates of childhood obesity, then we can see that the mental health fallout associated with childhood obesity would also have worsened. When we talk about COVID-19 and how it would have impacted the mental health fallout associated with NCDs, well, just by virtue of having one of the physical NCDs or even a mental NCD, a person was at higher risk of having a severe COVID-19 infection or dying. And even before COVID-19, we were way off target with meeting Sustainable Development Goal 3.4, which was to reduce the premature mortality from NCDs. So the mental health fallout from COVID-19 with respect to NCDs would actually have been much greater. In addition, there was significant disruption of the NCD service provision, the healthcare, that would have pushed us even further away from meeting that goal. So if you're increasing NCD rates and you're increasing the rates of NCD complications, then it's not a stretch to see that you would be worsening the NCD-related mental disorder rates. And this infographic just shows from WHO that over 130 countries reported that they had either partial or complete disruption of their NCD services. And I still do need to make the point that even though dental care was managed, although mental health is one of the NCDs, there is no mention in this of the disruption in mental health services that would have occurred. So again, still not receiving the priority that it should. I'll speak very briefly about the impact of COVID-19 on the mental health fallout of climate change. You will hear very shortly a lot more about climate change. But theoretically, there was supposed to be a reduction in greenhouse gas emissions because of the COVID-19 mitigation measures. But what seems actually to have occurred is a worsening of the climate crisis because of changes in food consumption, the patterns of food consumption, as well as an increase in sedentary periods by these same COVID-19 mitigation measures. And the small island developing states, because of their small and tourism-dependent economies, would have experienced a much sharper decline in GDP than other states, and that would reduce their ability to adapt to the climate crisis. So in that way, COVID-19 would have amplified the adverse effect of the climate crisis on mental health and mental health related to climate change. So in summary, we put it to you that the COVID-19 pandemic actually impacted in a negative way all of these pre-existing pandemics and has actually acted as a threat multiplier for global mental health, especially that of children. We expect an exponential increase, therefore, of the burden of disease associated with mental disorders and, of course, the economic burden associated with mental disorders, and urgent solutions are needed. You will hear more about solutions in our final section, but briefly, those of us in mental health advocate for a strengthening of the existing national mental health policy for Antigua and Barbuda. We advocate for school-based mental health programs that are associated with capacity building for guidance counselors, coping skills training at all levels of the community, as well as education on nutrition and the factors associated with childhood obesity, exercise as a means of improving not just physical, but mental health, a reduction in stigma of both obesity and mental health issues through public education. We believe that small communities should be embraced as social support networks, and we also advocate that not only health, but mental health policy needs to be inculcated into all health policies. Thank you very much.
Thank you so much for that discussion, Dr. Brathwaite, and also Aspen and Myrna. So we're now going to have something unexpected, a little fitness break to allow us to stretch our limbs and have some fun since we've been going for just over an hour. Please join us as Danielle Walwyn takes her fitness break.
Hello everyone, my name is Danielle Walwyn. It is a pleasure to be here with you to move. I'm going to be leading you in a movement break, so I'm going to invite everybody to stand up. We can't be talking about health. We have to practice what we're preaching, right? So this movement break, it's going to be very short, and again, it's an encouragement to you to integrate these wherever you can, in between work meetings, in between classroom and learning, wherever you can. Integrate them. There's so many benefits to just this small amount of movement, and I think you're going to see that for yourself. So for this movement break, you're going to need one thing: a water bottle. So I'm going to give you a moment to grab that. And the song that we're going to be moving to is called Sweet Enough. It's part of a campaign called You're Sweet Enough, put on by Lake Health and Wellbeing in St. Kitts and Nevis. So I invite you to go and check them out. They're doing some brilliant work in terms of just general health promotion and specifically around sugar sweetened beverage tax in St. Kitts and Nevis. So check them out, Lake Health and Wellbeing. I think I've given you enough time to grab your water bottle. Yes? Are we ready to move? Great.
Hold on, stop. Think about the drink before you take a drop. Read up on the label on the back. They say science sugar low in fat, but don't be fooled by that. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody you're sweet enough. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody, hey. Hold on, stop. Think about the
Hey, see, very convenient. Have a sip of that water. Awesome job. Take in how you're feeling right now and enjoy the rest of the program.
Awesome. Thank you so much, Danielle. All right, you can keep moving in the background. In the meantime, I'm going to switch over to our next presenters. Mr. Stefan Minish is a visiting master's student from the University of the United Nations, who is researching the impact of climate change on Antigua and Barbuda. He will be assisted by first-year medical student, Sujit Dasanayaka. Over to you.
Thank you very much for the introduction. I'm going to pull up my slides. Okay. Which one are you seeing now? With the notes again? Okay, very warm welcome also from my side and from my colleague. We're going to talk about climate change and its impact on childhood obesity on the Twin Island states, but also on COVID-19. Just a brief introduction, what we're going to speak about. First of all, climate change in general and its impacts, then about local trends on Antigua and Barbuda, and how they are related to challenges in the context of childhood obesity. And in the end, we're going to have a brief introduction on possible solutions. I want to highlight here that what we're going to present is just a glimpse what could be potentially important, but due to time restrictions, we had to focus on what we thought are the most important factors. So first of all, climate change is a state in the climate that can be identified by changes in the mean and or its variability of its properties, and that is important over an extended period of time. And this could be due to natural internal processes or to external forcing, and human activity is a part of the latter one. Okay, next one. Climate change affects the living world as a whole, so not only the environment, but also the human systems. And that is mainly through their impacts on ecosystem services, which are manifold. They contribute to jobs, economic growth, food security, health, and well-being. And beside direct impacts like changes in water quality and availability, or changes in natural rhythms and or seasons, we can also observe indirect impacts, for example, in the migration patterns of species that change the environment. Now, when we look into the local context, we are observing an increase in temperature from the early 1900s to 2020, up until 1.5 degrees Celsius. And this is important because rising temperatures impact water demands, agricultural productivity, health, energy usage, which is related especially to air conditioning, but also individual thermal comforts. Increased evapotranspiration will also affect the severity of droughts on the islands, which are already a problem. And they also will affect the local flora and fauna composition, productivity, and migration patterns, as I mentioned before, of species. And islands are in particular sensitive to those changes because of the high level of endemism. When we now look into rainfall patterns, when we look on the annual perspective on the top left side, we are barely able to see a significant trend. However, we are able to see that we are already experiencing more extreme events in both directions, positive and negative ones, and also an increasing frequency. However, especially when we talk about food security and water availability, which are heavily related to childhood obesity, it is worth looking into the rainfall patterns of specific months. I just picked here, for an example, June, because depending on the perspective, there was a lot going on. Now, what we can see here is that we're already observing a decreasing amount of rainfall throughout the month. However, this rainfall is splitting over an increased amount of days, which means that even if it rains, those rains bring less rainfall than before. And also the number of heavy rainfall days doubled, which is also very important to the agriculture sectors, because heavy rainfall not only causes erosion, but also can damage crops itself. When we now talk about the intersection of rising temperatures, increased evapotranspiration rates, and decreasing rainfall, it is not a surprise that we also see an increase in drought duration, and that specifically accounts for severe droughts and serious droughts. And this is a big challenge for the agricultural sector, what we're going to talk about in a bit. Also very relevant for small island developing states and also for Antigua and Barbuda is hurricane frequency and intensity. And in line, we also are able to observe more intense hurricanes and also an increasing frequency of years with more than one hurricane event. These years are marked here in this graph with the red dots. What is also projected for the future is that hurricanes will have a decreased transition speed, which makes them even more destructive when they make landfall. Sea level rise is also important for islands because a lot of their infrastructure is on communities are placed at coastal proximity. And when we talk about the local rates, Antigua is actually showing an increased rate compared to the global average, about 1.8 millimeters a year, and also high rates of erosion, 0.8 meters a year, which potentially affects not only livelihoods that depend on tourism, but also available recreational space in coastal proximity. Another issue that is related to sea level rise is actually saltwater intrusion that is exacerbating the water stress on the islands. When we now talk about the affected area sectors, sea level rise is a major issue for all of them. However, we can see that agricultural land, crop and plantation are specifically mentioned, but also the major income generating industry, which is tourism. What is here not specifically stated, however, it is important that also schools, recreational grounds, but also health facilities are located in coastal proximity, which makes them sensitive to sea level rise too. Ports have a specific role on the island because they're not only important for tourism, but also for import and export, and therefore also have an impact on local food prices and food security. And all of that, when we look at the projected costs of sea level rise, and this is just sea level rise, not to mention all of the other climate stressors, this amount we're seeing here, 2.8 billion, about 1 meter sea level rise, it is important to keep that in mind that those costs will not be available for other sectors or programs. Just to briefly mention sea surface temperature, we are able to see already 1 degree Celsius in about like 30 years now. And this is very relevant for all of the marine ecosystems, which are heavily contributing to food security on the islands. Before we talk about the impacts of climate change on the water sector or water situation on the island, just a brief introduction. Antigua has no perennial rivers at all. They're heavily reliant on surface water for agricultural practices and mainly on desalination plants for freshwater availability. However, rainwater harvesting is mandatory since a couple of years. on the household level, and is also a very important contributor to fresh water security on the island, and also challenged by climate change developments. So when we now talk about the risks that are associated with the stressors I mentioned before, saltwater intrusion, decreased water availability, but also the contamination of reserves and reservoirs, they can be translated into challenges in the context of childhood obesity. And the implication of water scarcity are manifold. They're not only impacting health and hygiene, but also food security, agriculture and farming, tourism, but also how families are actually able to prepare their food back home. The already dry climate and frequent drought events are already limiting crop production on the islands, food security, but also adaptation options that could be used to meet local demands in the future. And the interseasonal precipitation variability, which I described earlier, are actually putting more stress on the water sources on the islands. The development in the agriculture sector is kind of similar to the water sector. We're going to see an increased fragility of this sector because in the context of childhood obesity, we are expected to have a loss of available land for agriculture and loss of soil fertility. Actually, pests and invasive species are increasing with changing temperatures and humidity levels. And hurricanes, which I talked about previously, are impacting crops not only on a short term, but also when we talk about perennial crops, about on a long term. And this affects them up to 3 to 8 years. Heat stress is also not only affecting us as humans, but also livestock themselves. And the unpredictability of growing seasons also impacts local prices, food security, and the animal feed value, which then translates again into overall meat quality on the island. Another important sector on the island are the fishery section, which is stressed by climate change, not only by habitat degradation due to extreme events, but also rising ocean temperatures and ocean acidification is changing the environment and threatens species throughout the ecosystems. Fish stocks actually contribute to 2 to 5% of the GDP of Antigua and Barbuda, but also within the region, and are very important for the maintenance of local traditional livelihoods, especially after the onset of local disasters. A lot of communities go back to fishing to secure their food sources. And they're also a very important source of protein for the local communities. When we now look on the picture on the bottom left, we are actually able to already observe that migration patterns of the subtropics, or like in general, that migration patterns of marine species tends to migrate polewards. In the subtropic, that means that fish composition is just changing because there are different fish species migrating from the tropical zone polewards. However, all of the fish that are migrating from the tropical zone to the poles are actually missing in the tropics, and that makes them less, like there is less catch overall for the local fisheries. What that means for the context of childhood obesity is that ecosystems are not only damaged by extreme events, but also extreme events have impact on the infrastructure and therefore impacting food security. The increasing pressure on seaports is not only threatening food security, but also affecting import and export patterns of the island, and therefore also prices. And the intensification of marine heat waves are not only impacting ecosystems, but also fish species itself by impacting their physiology, metabolism, and catchability. To sum that up before we deep dive in the topic of health, climate change is not only impacting individuals, households, and communities and ecosystems, it's impacting the whole living world combined. We are able to see direct and indirect impacts, and especially the impacts on food security, availability of natural resources, and human behavior are related to childhood obesity. all of the costs that are dedicated to climate change and disasters, limited the availability of resources that are available for other sectors, and the changes in the socio-ecological system entail a variety of challenges for individual and public health issues. And now I'm going to hand over to my colleague.
Thank you, Stefan. Climate change can majorly impact individual and public health, and climate stressors such as water scarcity can increase water and vector-borne diseases. Increased heat and storm frequency and intensities can increase the risk of death and injury, affect medical services, and damage health infrastructure. But in the context of childhood obesity, these same stressors, combined with the fact that children are at risk for obesity, can affect food security and contribute the burden of malnutrition and increase rates of diet-related NCDs. Another area is that public health and healthcare professionals with training required to deal with climate change are actually not really available present in Antigua and Barbuda, and we need more people trained to deal with these kinds of disasters. Another issue is that intense drought and high industrial concentrations can affect the respiratory system and limit physical activity, which is another risk factor for childhood obesity. And we talked about previously that adverse weather events can damage the health infrastructure. Antigua and Barbuda has 27 health centers and 1 hospital, and damage to the health infrastructure can really disrupt patient services, as has been seen with Hurricane Irma. And the need to have health infrastructures that can withstand climate change as well is important. As we move on to the next slide, in Antigua and Barbuda, the burden of disease, as you can see on this table on the right, indicates that a majority of health concerns, about roughly 78%, are the result of non-communicable diseases. And facing these diseases on top of the climate change related health risks could exacerbate health conditions. Specifically, if we look at heat stress, and as temperatures and intensity and frequency of heat waves increase, people are at risk for health-related medical conditions, such as heat rash, heat cramps, dehydration, heat exhaustion, stroke, and death. And children, elderly, and those with pre-existing conditions are particularly vulnerable. And so another issue with climate change-related health is vector-borne diseases. As temperatures and precipitation and humidity can change, they'll influence life cycles of vectors and then infectious agents that they carry. Specifically, the Aedes aegypti mosquitoes produce more rapidly in the warmer temperatures and proliferate in groundwater in periods of high precipitation and water stored receptacles. And they're responsible for the transmission of chikungunya, dengue, and Zika. And Antigua and Barbuda actually had epidemics of these in 2015, and cases of dengue and Zika still around now. Next slide, please. And as our colleagues have already expanded on, mental health and physical activity are also contributors to childhood obesity. And specifically, natural disasters can have profound effects on the mental health of children. Experiences with disasters can increase the rate of post-traumatic stress disorder, injury, depressive disorder, anxiety disorders. And these climate change related disasters disproportionately affect the mental health of women, older age, those in poor health status, and can affect those that actually witness death or dead bodies. And although we don't have data specifically from Antigua, there are a couple of case vignettes from the psychological harm that happened as a result of Hurricane Katrina. A 4-year-old girl was separated from her parents for several weeks. After she was reunited, she displayed behavior issues like burning her dolls and things like that. Another 5-year-old whose apartment possessions were destroyed resulted in displaying sleep disorders, nightmares, and PTSD. So these are all effects of climate change on mental health. And physical activity, as climate changes, the patterns of exercise also will change. So physical activity can be reduced on days that are acutely hot or cold or rainy days. And in conjunction, when there's air pollution or extreme temperatures, that can also negatively affect physical activity levels. Next slide, please. Although there's no direct evidence that climate change impacts COVID-19 transmission, Generally, most emerging infectious diseases originate in wildlife, and climate change alters the relationship of the interaction between humans and animals that can influence human health and risk. There's increasing evidence that human pressure on the environment may drive disease emergence. And climate change and pandemics share drivers. So specifically, if we look at deforestation, the root cause of climate change that can destroy habitats and increase the risk of pandemics by displacing animals and putting them into contact with people. Another example is greenhouse gas emissions from large livestock that can contribute to climate change. At the same time, put people in contact with animals as well. So there's a kind of synergistic approach there. Next slide, please. And if we look at all these factors, climate change impacts children and childhood obesity by several different factors. There's kind of a synergistic effect. We talked about the access to medical health, and climate change can affect the medical response capabilities, could damage infrastructure. It could actually affect the healthcare personnel as well, and at the same time limit children with medical complications their access to medical services. And then there's also other underlying issues such as increase in vector-borne diseases, which can affect activity levels. Parents might not want children to go outside during, in areas where their vectors are increased. Increased heat stress and less restorative sleep. These can all kind of factor into a reduced activity levels. And then we also heard about how the importance of mental health, well, potential injuries and anxiety and depression can also contribute to mental health. And more importantly, climate change can alter the access to food and increase dependence on external markets, as we've seen, and limit the availability of nutritious foods for children, all kind of culminating in a promoting an unhealthy and more sedentary lifestyle that would increase the risk of childhood obesity. Next slide. And for our potential solutions, we wanted to address the major effects of climate change on Antigua and Barbuda that could majorly affect childhood obesity, specifically water scarcity and access to food. We identified farming techniques that would be sustainable, improve agricultural productivity, and be resilient to climate change. And one of those systems is the use of rooftop hydroponic farming, where plants are grown in nutrient solution rather than soil. And this technique synergistically addresses water conservation, better utilization of water, and directly having access to food, and then addresses childhood obesity by providing children to convenient and healthy food. Another practice is the use of contour farming to align plants with soil and with the angle of the water flow, and that would slow water down, allow it to be soaked in, increase filtration rates, and minimize erosion. And to expand on fallow farming systems, so to increase the biological activity and nutrients of the soil. And one example that's been implemented in the cook stump is the use of vetiver grass, and they're using that to recharge, the groundwater, and then use it as a biological pest control. So, as next slide, please. Climate change is going to impact us for many years to come, and we need to find local and innovative solutions and think outside the box. Here is an example of what an African community in Kenya did. They used agrivoltaic system to plant crops beneath solar panels, and they added a rainwater harvesting system. And these systems provide a nurturing environment for crops. They help water conservation, reduce heat stress, and also are producing energy, a renewable source of energy. So in conclusion, the impact of climate change is manifold and can affect public health in many ways. So as we look towards combating this issue, we need to incorporate interventions that are tailored to the local context of health while holistically addressing climate change. Next slide, please. And we'd just like to thank the organizers, and I'd like to acknowledge our group mates who did a tremendous job on this presentation, Darnisha McComb and Alondra Rosales Montalvo. I'd like to thank Dr. Walwin for providing this amazing opportunity. And finally, I'd like to thank Stefan Monik for his mentorship, who guided us and organized this presentation. Thank you.
Thank you very much for your presentation, but also your attention to the attendees. Here are references. If you have any questions, feel free to ask them in the chat or add them to the Q&A later on. Thank you very much.
Thank you very much, Stefan and Sujit. Our next speakers hail from Illinois. Dr. Jafia Ramkumar is a board-certified internist who focuses on climate action. Her colleague Erin Meyer is a registered dietitian, and her focus is on enhancing access of communities across the United States to healthy food. Welcome to both.
Hi, I'm sorry. Good morning, everyone. Good afternoon. Can everybody hear me and see my slides?
Yes, we can.
Yes, thank you. It's a pleasure to continue this discussion, specifically looking at the very important issue of food security. There was a lot that you heard from the previous presentations that really dovetails and reinforces a lot of the points that we're going to make in talking about food security. So let's get started. So according to the World Health Organization, food and nutrition security exists when all people at all times have access to safe and nutritious food, have access to safe and nutritious food to maintain a healthy and active life. The United Nations recognizes this in its Sustainable Development Goal number 2, which is zero hunger by 2030. And we know that this requires an available and reliable food source at all times, which we want to be grown sustainably and regeneratively. So we can see that food security is closely linked to the economic and social health of a nation, the society, and of an individual. And with this in mind, the government of Antigua and Barbuda developed a food and nutrition security policy in 2006, which they updated in 2012 to address critical food and nutrition problems of the country. In looking at the 4 pillars of food and nutrition security, we look at factors that affect one, the availability. In Antigua and Barbuda, there is a very heavy reliance on unhealthy imported ultra-processed food and drink products, which is then coupled with an inadequate production of locally grown produce. And so while the total food energy is able to meet the population food energy goals, the country faces an undersupply of staples, vegetables, and legumes, but an oversupply of energy from foods from animals, oils, fats, and sweeteners. Number 2, access to healthy food. And we know that this is constrained by rising food prices, especially post-pandemic, as well as high levels of poverty. Number 3, utilization and nutritional status. Antigua and Barbuda, as we've seen, is experiencing this epidemiological transition of obesity and NCDs as a result of the nutritional shifts that you've been seeing the data for from the previous presentations. Number 4, the stability of supply. As a small island developing state, Antigua and Barbuda is very sensitive to any external shocks, such as the impact on food supply chains from external economic forces, from shocks from climate change and extreme weather events. And I'm going to elaborate on these 4 pillars now. So Dr. Walwyn gave us this overview of the history of the islands and some of the traditional food culture. And we can see that from the 1980s, there was a transition that started with a shift away from diets which were steeped in the traditional staples like starchy roots and cereals, the locally grown fruits and vegetables and legumes, limited foods from animal meats, to the diets that are more energy dense and consist of more processed foods, animal protein, especially from chicken. Antigua and Barbuda import chicken that makes up more than 74% of its meat imports. More added sugars, especially in the form of sugar sweetened beverages, more foods that are high in fats, oils, sodiums, and often more alcohol. And this shift towards unhealthier foods is unfortunately starting at a younger age, with almost 3/4 of children consuming 1 soda daily. The reasons for this unhealthy food choices are complex and they're challenging. I mean, we know that these products need little or no preparation. They're convenient to consume. They're aggressively marketed. They are ubiquitous, and they're created for visual and taste appeal, and often at low cost. And all this is shifting taste. All this shifting taste is resulting in an ever increasing food importation bill. In thinking about the availability of food types, we know that about 79% of food in Antigua and Barbuda is imported. In the supermarkets, the majority of the products, as we can see from this typical aisle, is in the processed to ultra processed food category. About 80% of fruits and vegetables are imported. To note, consumer tastes are changing. People are wanting things like Irish potato, kiwi, grapes, none of which are grown in the islands. Even much of the traditional ground provisions like cassava, dasheen, and plantains, these are all imported. In this picture of a produce section of a local Antiguan supermarket, most of what you're seeing here is imported. We can see that the food import bill from 2001 to 2011 has increased by about 84.2%. I don't have any current data, but we have every reason to think that this trend is increasing. And this picture of a local roadside shop has a vendor selling local produce, but she's also selling these snack bags of processed food. They are everywhere. Global market deregulation has also had a direct effect on increasing the sales of processed and ultra-processed foods. And all these factors all contribute to Antigua and Barbuda's status as a net food importing developing country. So, and this slide shows that there's been this proliferation of international fast food chains with the local, unfortunately, the local restaurants following suit, as we can see. And this all fuels the unhealthy lifestyle and nutritional transitions. This slide gives us a snapshot of the cost of groceries versus eating out. You can see that the cost of food is generally high, but eating out takes a much bigger bite out of the budget, especially for the poor. And this slide kind of summarizes everything that we've been hearing from all the previous presentations. Since the 1980s, it's been clear that as people's food preferences and tastes move away from the traditional diet to processed and ultra-processed foods, this has led to an increase in overweight and obesity, which has then led to an increase in nutrition and food-related NCDs and to overall poor health. And we've seen the sobering stats for this. And this was all recognized by the Caribbean Ministers of Agriculture as far back as 1996. In looking at shocks to the stability of supply, as a small island developing state, Antigua and Barbuda is particularly vulnerable to these external shocks. And we can see from looking at the left of this slide right here, that you can look at the economic impact of climate change and extreme weather events such as Hurricane Irma in 2017 and what it had on the agricultural and fisheries sector, particularly in Barbuda, which suffered a direct impact. It decimated crops and livestock, the bees and the bee industry, the fishing industry, infrastructure and machinery. And we can see here the cost of damage and of recovery. Another huge shock was the COVID-19 pandemic, which caused unprecedented increases in food insecurity in 2020 and 2021 due to the social and economic disruptions. And this study showed that 40% of people in Antigua and Barbuda were moderately to severely food insecure. That's quite significant. And looking at the most recent global shock, this Forbes article was talking about the fact that food security in the Caribbean was very likely to be impacted by this Russia-Ukraine conflict. So with all these factors in mind, there have been national action policies focused on food and nutrition security. The National Food and Nutrition Security Policy from 2012 that I talked about earlier is closely aligned to the Caribbean community, the CARICOM's Regional Food Security Plan for 2011 to 2025. And their goal is to address current and any foreseeable critical food and nutrition problems of the region. Now, while the COVID-19 pandemic caused significant disruptions in food security, livelihood, and caused health impacts, it also created the opportunity and the momentum for food systems transformation in the Caribbean. At a CARICOM head of government's meeting in 2021, the ministers endorsed a strategy which would drive the transformation of the agri-food system. And lastly, during the pandemic, the Ministry of Social Transformation implemented the Emergency Food Assistance Program to provide food and medicines to the island's most vulnerable. So in summary, we can see that the dependence on imported food is fueled by changing tastes and preferences for non-local produce and processed foods. And this, coupled with other factors, has led to a decline in the agricultural sector. The preference and easy access to unhealthy foods, increased animal protein consumption, inadequate fruit and vegetable consumption has contributed to the high prevalence of overweight and obesity and the increase in NCDs. Another challenge that was identified was the lack of and difficulty in accessing data on things like anthropometric measurements of children, on information on food consumption patterns. And as was stated much earlier, much of the data that we gathered for this part of our presentation was from the Food and Nutrition Security Policy from 2012 and years before. It was hard to get information for subsequent years. And with this, I'm going to turn it over to my colleague, Erin Meyer, who's going to be talking about agriculture in Antigua and Barbuda.
Hi, everybody. Next slide, please, Jafia. As we move into our overview of agriculture on Antigua and Barbuda, I'm going to share a brief overview of the landscape and watershed. Antigua is a relatively flat with no permanent rivers and very few springs. And about 22% of the island is forested. The average temperatures on the island range from 70 to 88 degrees Fahrenheit. And as you've heard throughout the presentations, fresh water is one of the most pressing issues on the island. They rank as one of the most freshwater stressed countries in the Caribbean with an average annual rainfall of 45 inches. This hot, dry climate made up of mostly clay soil and significant water stressors creates large obstacles in agricultural production. Next slide, please. The current agricultural sector is largely comprised of subsistence farming or small-scale commercial farming, supplying less than 20% of product to the domestic market. This sector contributes a minute 2.2% to the GDP and represents only about 1.9% of the labor force. Now, highlighting the local fishing economy, this economy contributes about 1/2 of the total value of the entire agricultural sector. Not only is the ag sector minute, you can see how small the biodiverse crop production is at this time. Who is farming? Women are more actively involved in agricultural production than men. They're growing in their backyards and they're creating value-added products to sell. Now, given the very limited scope of the current agricultural system in Antigua and Barbuda, the Ministry of Agriculture's current initiatives that align with CARICOM's push to transform the regional food system include a shift from a subsistence model of farming to a more informed, modernized way of a viable, sustainable business model. To attract even more women and youth to become farming professionals, and to drive up the demand for local produce with programs like Buy Local, Consume Local. Next slide, please. A few key highlights within the current agricultural system include there is increase in domestic production, but it's not fast enough to keep up with the demand. In addition, locally grown fruits like pineapple and mango are abundantly available, but consumers are choosing imported fruits like apples and grapes. At this time, the local supply chain infrastructure is complex and limited, and this local supply chain must grow to meet the demand. Livestock. Egg production on the island is robust compared to other livestock farming, which is very small. The majority of animal protein is imported. Jafia mentioned that earlier, but I want to go back to the fisheries. Antigua and Barbuda is made up of small-scale fishermen and fisherwomen who catch both out at sea and inland. However, this catch does not meet the local demand, which leaves Antigua and Barbuda to be net importers of fish. Challenges in this sector include the degradation of reefs and ocean by development, climate change impact, and impact from invasive species. And lastly, there is a problem with larceny, or people stealing product from gardens and farms. There is also a problem of a guaranteed market for farmers in supermarkets and restaurants that need to be looked at. Next slide, please. Given the very limited scope of current agriculture in Antigua and Barbuda, the Ministry of Agriculture is working to train and practice climate-smart, regenerative agricultural ways of farming. Current practices include: there are 1 to 3 acres of diversified growing happening, and these are divided into small plots, growing many different crops in a rotation that will optimize and grow soil health. Growing resiliency, using and expanding their seed varieties that handle drought, pests, and disease. And one of the success stories that we have been told by Dr. Alabanjo is that the ability to grow tomatoes in the summer that are resistant to white flies. They're using seeds that are promoting this resistance. Combating water stressors. Antigua has been climate smart about water before many of the other islands. They depend largely on rain-fed systems and have water harvesting systems with ponds, dams, and catchment containers implemented. Drip irrigation systems have long been utilized, and the government allows for duty-free importation to help build on these systems. Seasonal extensions. Protected agriculture with shade house production controls heat and conserves water, and this is heavily promoted, and we heard this in our last presentation. Looking at pest, weed management, where the island is still using herbicides and pesticides with backpack sprayers. There is an issue with chemical drift, and what's happening is that education is a key for the farmers to help control some of these items. Lastly, fertilizing. They're using animal manure from local livestock farms, chemical fertilizers, and compost as fertilizer management. A new program, composting yard waste through the Grow Antigua Compost Factory, is also being implemented within their system. Next slide, please. Moving from current agricultural production and practices, I want to touch base on the challenges. The Ministry of Agriculture is working to increase the agricultural sector, but there is currently a steady decline. And this decline is due to 2 of the issues that you see here. In the left-hand column, we're seeing a decline due to competitiveness. In the right-hand column, the decline the decline in productivity is due to what you're seeing in that right-hand column. Next slide, please. While there are challenges throughout the local value supply chain, from the limited growing network of farmers to the current processing and distribution infrastructure to consumer demand and finally food waste, there is also great opportunity. Next slide, please. Opportunities have turned into initiatives to tackle food insecurity, and a significant initiative is the UN Zero Hunger Challenge, started in 2013, which was in keeping with a Sustainable Development Goal number 2 of zero hunger. This was a multi-organizational collaboration with the Ministry of Agriculture that launched the Backyard Garden Project and the National School Meal Program. And I'm going to turn it back over to my colleague, Jafia, to tell you more about these programs.
Thank you, Erin. So I'm just going to take you through a couple of the initiatives. So this is the Backyard Garden Project, and backyard gardening is seen as a critical element in increasing food availability at the household level in meeting the Zero Hunger Challenge. This program started in 2013, but saw a huge upsurge during the pandemic. And currently there are about 2,500 households participating and benefits about 7,500 people on the island. Women dominate by a ratio of about 3-to-1. And the Ministry of Agriculture supports this program by providing free or low-cost seeds, seedlings, fruit trees to grow traditional vegetables such as okra and eggplant, and the ones that are typically imported like tomatoes and carrots, etc. And it's been pretty successful in that the gardens produce about 280 tons of vegetables per year. Additionally, the extension officers provide technical support and do educational programs on drip irrigation, shade house production, and such. About what's been successful too is that about 5% of the participants have transitioned to semi-commercial and commercial operations. And even better, it's expanded to be in 33 schools, which provide produce for the National School Meals Program, which I'll elaborate on next. The main benefits that participants have reported are saving on food purchases, eating more vegetables, using their gardens as a source of income by selling the produce at local markets and shops. Home production has also created jobs in the processing of produce into sauces and jellies and jams. And this is the National School Meals Program with their motto, Nutrition for Learning. The School Meals Program began in 2011 and has been steadily growing. Currently, all the students in the public primary and preschools are fed hot lunches daily for free or at a nominal cost. The meals are prepared in a central kitchen and they're distributed. Most students enjoy the meals like the rice and beans and the curried chickpeas and the green salad that's shown in this picture here on the left. But it's been noticed that they don't really want to eat the cooked vegetables and prefer to eat them in a salad. And what is interesting is that the way they seem to like eating the cooked vegetables is in the traditional pepper pot soup, which you're seeing here on the right. And they also note that they don't seem to want to eat traditional root staples like yam and like cassava. So these have been problems that have been identified, or challenges that have been identified, and this is along with the lack of a nutritionist on staff at present. This is the Gilbert Agricultural and Rural Development Center Initiative, or GARD Center Initiative. And this is through the Ministry of Agriculture, and its mission is to train young people in practical agriculture and to promote farming as a worthy and viable occupation, which, as we can see from the statistics in terms of the labor force, is sorely lacking. And this slide shows some of the training courses offered by the extension officers. Another initiative is the Farm to Table Initiative, which is a relatively new program. It's maybe about 5 years old. And this is to connect farmers with hotel chefs to supply niche produce such as arugula, microgreens, and it's being promoted heavily through outreach by the Ministry of Agriculture. Lifelong Learning for Farmers Initiative. This targets, again, women and youth and focuses on linking human capital with social and financial capital, and emphasizes the continuous learning among farmers in subject areas that are typically non-traditional. So they really want to emphasize things like money management, savings, having a business plan, using technology on their farms. And one of their major goals is to create partnerships to build markets and grow the value supply chain. After the devastation by Hurricane Irma in Barbuda, there's been this initiative to rebuild the agricultural sector, which was devastated, but in a very sustainable, regenerative way. Many regenerative agricultural practices are being promoted, as well as building back markets for products like this honey, as that you can see in the right lower corner. And this honey is from the logwood trees, which is prized in Barbuda because of the pristine, unpolluted areas that these logwood trees grow. And finally, this is a dashboard of where these initiatives are in meeting the Sustainable Development Goal number 2. Now, it's a busy slide, but I just want to say that pretty much none of the targets for 2030 have been met, and we can see that here. We can see that there's been fair progress in ending hunger, malnutrition, and access for safe and nutritious food, particularly amongst the most vulnerable. And we can see that there's been limited to no progress in meeting the agricultural sustainable food production systems goal. And these are solutions. There must be solutions to address these deficiencies, and we're going to be talking about this in the next in the solutions section. And you've heard many of the solutions talked about in previous presentations. And with that, I thank you and look forward to hearing your questions in the Q&A. Thank you.
Thank you very much, Dr. Jaffe Aramkumar and Erin Meyer. We've had so much food for thought so far for the afternoon. Our final content expert, before we get to the students and the solutions that have been mentioned a few times, this person has vast experience in the field of health economics and has worked with multiple governments throughout the Caribbean to improve equitable access to appropriate health care. Please welcome Dr. Stanley Lalter. Over to you, Dr. Lalter.
Thank you very much, Karen, and good morning, good afternoon to our participants. The good thing about coming as a late presenter is that I can leapfrog over much of the background material, and I can also leapfrog over several of the key points that persons would already have raised pertaining to this whole matter of childhood obesity. I want to focus more on what is called the economic and the fiscal aspects, where the fiscal really relates to the role of the government, taxes, subsidies, grants, guarantees, and any other instrument or policy that the government itself uses to try to influence change in society, and particularly change in production, import patterns, as they will affect childhood obesity. The main focus of the presentation really is to look at this economic structure, this economic environment in Antigua and Barbuda. There's some things about the structure of the economy that we need to pay close attention to, because it determines very much what are the risk factors for childhood obesity, as well as the structure and environment will affect whether the strategies, the solutions, and the proposals for change that we are going to be suggesting, whether these are feasible or not feasible. And that's something to bear in mind, because we can have a whole range of solutions and suggestions. Feasibility, if we want to get the interest of government, if we want to get the interest of private producers, if we want to get the interest of social partners in all of this, we have to consider feasibility, and economics and fiscal aspects play a very key role in all of this. Sorry. Right, let's focus on a couple of the key features key features of the economy of Antigua and Barbuda. Particularly in all of this, what I want to do is to link this, what's driving and what's influencing, and the prevalence, the depth, the severity of obesity. The data for that has already been presented. Let's take out three aspects of what we call the feature here. Firstly, it's a small country. It's a very open economy, meaning that it's very dependent on international trade for goods and services. It's very dependent on travel for tourism, and that brings in about 60% of the GDP or 40 to 50% of the employment in the country. Very dependent upon that international, the global system for international investment in financial services. Trade to a very large extent means, in the case of food production and agriculture, in the case of consumption, imported foods, imported beverages, cheap, processed, sweetened. And these drive to a very large extent local as well as tourist consumption patterns. The key question which could be asked in all of this is, well, really, could we replace a lot of these cheap imported processed foods with local production? And I think Jaffe was hinting at some of the changes which are being made in agricultural production. Well, to a very large extent, one can try. But then given the small size of the country, economies of scale will play a very important role. Is it also going to be economically feasible to produce for the likely demand in the population? And that's something which came up very early on, because there was a time when, before there were all of these big imports coming into the country, there was a bit more local consumption of locally produced goods. But very soon, demand exceeded supply. And when demand exceeded supply, you had to turn to imported goods to fill the gap. And very soon, the imported foods, goods and services replaced local production. So if we now want to turn that all the way around, so that we can cater to local demand as well as tourist demand from local food production, then this could be a constraint that we have to bear in mind, unless, of course, our techniques of agriculture are going to be changing completely. A second major aspect of the Antigua and Barbuda economy to bear in mind is that this is a high-income country. It's not a low-income country, it's a high-income country. You have high income and you also have a high degree of inequality. What does this mean? Because you're a high-income country, it means altogether that you have limited preferential treatment outside there. If you're a member of the World Trade Organization, you're a member of the International Monetary Fund, the World Bank, of all of these, high-income country, you have limited preferences, which means you cannot impose very high tariffs on goods coming from other countries, because if you do that, they will do the same to yours. Now, that sort of puts a very big barrier on your ability to adjust your import duties, your tariffs, your taxes, because if that is going to discriminate against production and imports of foods coming from other countries, then you have a problem of dealing with the WTO, because you are a high-income country. Low-income countries have a bit more flexibility. What does the inequality have to do with all of this? Well, inequality has two major considerations. One is, let's take, for example, that group that we can call the non-poor. The non-poor in Antigua and Barbuda have a very clear preference for imported foods as against local foods. And that's driven to a very large extent by what is called consumerism. Consumerism, advanced marketing, advertisements, for example, coming from the north, the whole pattern of what we like to call trade liberalization and globalization. We're part of a global market. And when you go through Antigua and Barbuda, as Jaffe, as Daniel were pointing out earlier, you look at the consumption patterns, you can very clearly see what's happening with respect to foreign foods, first world taste. So that's on the non-poor side. What about on the poor? Well, to a very large extent, when you have limited resources, you try to find what is cheap, what is convenient, and to a very large extent, a lot of that is going to be imported. So what you end up with is both on the non-poor side as well as on the poor side, you have childhood obesity based largely on the consumption of so much imported, cheap, processed, sweetened foods. Childhood obesity is a problem at both ends of the income spectrum. The critical thing about the consumerism and what is called the rights of the consumer, you cannot tell me how to spend my money. And if this is where I want to spend my money, then let me consume now and repent later. And that's what the advertisements, that's what the marketing is going to tell you. And that poses a major challenge when you're speaking about behavior change. A third aspect of the profile of the structure that we want to look at is that Antigua is a very highly indebted country. Highly indebted means that your debt to your GDP, it's almost like 100% of all that you produce in the country could be spent on repaying your debt. So there's a large amount of money that is required to pay your debt, both to be able to get more loans and in order to sustain what is called your creditworthiness outside here. What then is government priority? Government priority is to pay debt. And all of the programs like childhood obesity reduction could be seen as back burner issues. So if you really want us to focus on that, you must show us why investing in childhood reduction is going to provide value for money and very high value for money, because these are my priorities: to repay the debt and to keep my creditworthiness alive. And the fourth aspect of the structure is the fact that because of the zone that we are living in, Antigua has already been described as very vulnerable to climate-induced events. With these, like hurricanes, drought, coastal erosion, what do you think the priority of government or the priority of the business firms is going to be? It's clearly going to be what we're going to call, let's try to put our money in improving or mitigating the effects of these. Infrastructure, housing, how do we protect productive sectors? To a very large extent, that means then when hit with hurricanes, with drought, with coastal erosion, childhood obesity control programs become back burner because there are other programs which could become priority programs. So then putting all of these together, it means that there are some aspects about the structure of the economy that play a very key role in driving childhood obesity, and that will also have a very key role in how we are going to confront the changes that we want to bring about. Just touching very quickly, because I think we've already dealt with these to a very large extent in terms of climate change, disasters, what Irma and Maria did to the countries with already limited land space in Antigua. The impact of these hurricanes have a negative impact on local food production. Anytime local food production becomes even smaller than what it already is, then it just increases your dependence on cheap imports of food and beverages. So climate and the environmental sensitivity of the country also plays a role in this. Drought also does that with low rainfall that affects food production, local food security, but it also drives up the imports and the propensity and the preferences for imported foods. Same thing with COVID. Let's look at what COVID has done. And COVID, last 2 years, has caused a major decline in travel, earnings from the tourism sector, reduction in activity, businesses, construction, wholesale and retail trade, etc. And all of these led to a major decline in the GDP of the country. In fact, the country in 2022 is poorer than what it was in 2015. Increase in unemployment. What did all of these mean? It meant that government has less money to spend. If government has less money to spend, it has to look at its priorities. Priorities means let's focus on pandemics, vaccines, treatment. Let's look all together at focusing on these. And to a large extent, it meant that some NCDs programs, including childhood obesity, had to fall by the wayside. Economics to an extent is driving and influencing very highly what's happening with childhood obesity. And economics also, can we reverse the economics so that we can reduce childhood obesity? And that's going to be the key challenge. How do we get value for money? If there are other priorities for government, how do we get value for money and show that if we spend money on solutions to reduce child obesity, that's going to be actually a good investment. It's going to be feasible. As I said, there are push and pull factors which are driving this consumption, high demand for processed foods. There's profits to be made. Foods are convenient, cheap, tasty, labor saving, addictive to some extent, mass-produced. Can we compete with that? If we say that we now want to produce more organic or local foods, can we compete? Can we do it in a way that is also convenient, cheap, tasty, mass-produced, labor-saving? Or we can't, then it means profitability may not be as high, you may not have much investment. So can we reverse the economics in this? We do know that a lot of these imported foods tend to be what is called ED&D, inducing sedentary lifestyles, energy dense, nutrient deficient. But how do we now reduce the economics? How do we show that if we invest money in childhood obesity reduction, it's going to be a win-win-win situation? It's a win for the private producers and sellers, importers, and the retailers and producers. They can get positive returns. It's a win for government because it will represent good value for money for spending the government. And it also brings immediate benefits to the at-risk groups by reducing childhood obesity and by bringing all the other associated benefits in terms of better performance in schools, improving productivity gains in the workplace and all of these things. And that's what investment is. That's what investment is all about. And that's what we are trying to do with reconceptualizing how we make an investment as against just spending on childhood obesity. So let's put it to the governments, to the private producers that we are investing. We're not spending. We're not asking to spend, we're asking to invest. What is this investment going to do? Well, firstly, we know that childhood obesity brings heavy cost. I think Siobhan and others were pointing out the cost, the direct cost and the indirect cost to the system. Two main costs that you want to look at. Firstly, it reduces your health. Secondly, it reduces what is called your human capital. And that's your capacity to earn, to learn, to contribute, to function in society, to function productively in society. All projections show that this is going to increase in the future. So if we make an investment at present, we are reducing a significant amount of the burden at present and in the future, benefiting children, benefiting families, benefiting the community, but also benefiting the country. Can we do this in a measurable way? Can we do this by looking at it from a cost-benefit point of view? Very much like how we did with respect to HIV/AIDS control. Very much like what we did with immunization control. Very much like what we did with maternal and child health. We can put a cost to what is the interventions and what are the inputs we want to make. We can put a value to the outputs, measure the outputs, and we can put a value to the outcomes. In some investment models, which I've seen, you can get a return of 2 to 1. Spend $1 or $100 on a childhood obesity reduction program, and you can get $2 or $200 return, 2 to 1. In the case of HIV, for example, I saw rates of return like about 5 to 1, etc. But that's what you want to look at when we speak about providing value for money and looking at all of this in relation to an investment that you need to make, because that is going to change the mindset. If you want to make sure that you get the producers, private producers, the governments on your side to make the change to control childhood obesity, then we have to change the mindset. And how do we do that? So there are a number of tools, there are a number of measures which one can consider. And some of these will be picked up in the solution side. But generally, how do we make use of taxes? How do we make use of levies? Yes. These are really the price signals because you want to influence the behavior of producers, importers, and consumers. So let's make use of taxes. And you want to tax in a way that it has value. In the case of one country in the Caribbean, they put a 10% tax on sugar-sweetened beverages, but the major manufacturers simply absorbed the cost, kept the price the same to the consumers, and therefore there was no change in consumption patterns. You need to change that. You need to be very, very conscious. What is the size of the change? Subsidies, tax holidays can also be used, especially for food production. But again, these must be specific, these must be time-bound, these must be limited because you do not want producers to be dependent on government forever. Regulations, packaging, breast milk substitutes, etc., like what is done with tobacco control, liability concerns, all of these can also be considered as part of the measures that you want to put in place. And another set of measures you might want to consider in all of this really relates to the whole matter of partnerships. The business that we're into relies on the private sector. Government cannot keep producing, cannot replace the private sector completely. So if you want to get them on board, we have to look at how do we engage in partnerships, not just in production, but also in physical activity. And again, partnerships can be measurable. If we're going to give grants to NGOs to get involved, this must be measurable so we can see outputs. And again, in some other countries, they've made use of what is called conditional cash transfers or vouchers for particular groups to access the right foods, milk supplies, and nutritional products. So if we want to look at measures to put in place, these are the range of measures, but all of this has to be put in a very clearly defined results-oriented framework. Otherwise, the policymakers, the private producers will look at the alternatives and not pay very much attention to us. And that's the value of looking at economics and all of this that's going to bring. Thanks much.
Thank you very much, Dr. Lalter, and thank you so much to all of our presenters up to this point. In this session today, we've considered many factors that can impact the epidemic of childhood obesity in Antigua and Barbuda, both negatively and positively. We've seen the multiplier effect of the COVID-19 pandemic on obesity and on poverty. We have also seen undeniable evidence of changing climate due to rising temperatures. This is a reflection of the world that our future physicians will be serving. We now see childhood obesity threatens the health of the population of Antigua and Barbuda and how it can erode the economic stability of the country, along with pandemics and climate-related events. We now invite our second-year AUA medical students to wrap this up, to present cross-cutting multi-sectoral solutions. I would like to welcome Kyra Wallace, Yushin Yu, Matthew Therty, Formina Suresh, and Ludwig Rivera. Over to you.
So let me just get this in presentation mode. All right, so we've heard from our content experts about the problem. So we're going to be talking today about what our solutions look like. So on the individual and family level, we recommend promoting exclusive on-demand breastfeeding for the first 6 months of life. This will encourage babies to get used to feeding when they're hungry rather than on a fixed schedule, which is a good habit to have as they move forward in life. Then we want to make sure that we're avoiding excessive juice, sugar-sweetened beverages, and whole milk in particular at any age. So we want to make sure that we're promoting low-fat milk use rather than whole milk. Then encouraging buying and eating locally and seasonally as people did prior to epidemiological and nutritional transitions. We want to also encourage physical activity to improve both physical and mental health, and then develop positive associations with health promoting behaviors, including never using food as a reward, never using physical activity as punishment, and encouraging normal sleep habits. Then on the education level, we want to invest in public education to reduce stigma related to both obesity and mental health. And then we want to increase the education about water scarcity, availability, and usage, including rainwater harvesting, to improve water security. We also need to include capacity building for school, workplace, and healthcare workers, where we provide coping skills training in combination with education on mental and physical well-being and the dangers of maladaptive coping mechanisms like alcohol, caffeine, binge eating, and other risky behaviors. We also would like to provide additional education for parents on health promoting behaviors. We want to help them learn how to define healthy weights for their children and the risk factors for being overweight and obese. We also want to empower parents and guardians to detect red flags regarding body image issues and depression and other related things that can damage their child's self-esteem, and help them to resolve to build that self-esteem rather than tear it down. We also want to talk about the benefits of sleep, limiting sedentary behavior, including screen time, the importance of physical activity and moving as a family. And ultimately, we would need parents to understand the importance of and embracing their role as quote unquote gatekeepers of the cupboards, as children cannot consume what that is not in the house. We also recommend building the capacity of community leaders from faith-based organizations, employers, NGOs, and parent-teacher associations so that they are knowledgeable of changes they can make in their communities to create healthy environments, including physical activity, good nutrition, and mental health. And then in terms of school intervention, we recommend initiating an annual award for schools as well as businesses and civil society that contribute to childhood obesity reduction. This creates awareness for the entire community so everyone can participate and play a role in helping these children.
Okay, so next, we recommend the youth engagement, which implements youth ambassadors from a variety of backgrounds for human and planetary health within schools, communities, and at policy level to increase their participation. Also for health facilities interventions, communities can implement policies to support newborn breastfeeding in healthcare facilities. Next slide, please. Okay, so another solution involves community programming to increase healthy food available by regenerating local agricultures. This plan includes backyard gardening and farm-to-table cooking classes for children using school garden and community farms, which will allow children not only to be exposed to the farming, but also to learn the farming and cooking as a life skills of making healthy food. Also farm-to-table, previous slide, sorry. Also, farm-to-table programs can be implemented for hotels and restaurants, which allows to increase the demand and the production of local produce. Lastly, locally grown produce can be exclusively used for national meal programs, which are funded by the government. Okay. Community can also institute community food banks to serve the most vulnerable by adhering to the local health food guidelines inclusive of fruits and vegetables. Next is to expand the roadside clean air campaign to implement and to plant fruit trees along the roadside. This has been requested by residents in the past, but mahogany and neems were planted instead. So this idea can be expanded by adding more arboretum of fruit trees to communities rather than just one location to improve the access. Also, the propagation can be extended to non-traditional vegetables such as broccoli, cauliflower, celery, and parsley.
And now for some government level recommendations: to institute and monitor user governance policies for public facilities and community centers to ensure mental and physical safety of its users. Another recommendation would be to close the gap between mental health and other health-related policy and services. Furthermore, to build community centers to support community-based programming for holistic health. Infrastructure improvement is another important aspect. Improvements such as cycling and walking networks while following road safety regulations. And in looking at cycling lanes, we would basically be talking about the cost of paint in order to get this done. Healthy workplace policies, including building codes to facilitate health promoting behaviors such as enhancing physical activity at the workplace, garden spaces at the workplace, and providing comfortable and supportive breastfeeding environments. The next aspect deals with food policies, such as implementing subsidies for farmers to facilitate increased supply and demand for locally grown foods. Also implementing nutrition warning labeling, basically food labeling made easy via a color system. For example, a black label indicating an unhealthy food. To restrict the sale and marketing of sugar-sweetened beverages and ultra-processed foods in schools. To incentivize the production of healthy food products. And another critical recommendation would be to repurpose existing resources to increase food security. And this could be done through lionfish harvesting, as lionfish are an invasive species to the local marine life. The invasive lemongrass can also be repurposed to produce lemongrass tea. Also, native pineapples could be better utilized to produce juice with no added sugar, a much healthier alternative to consuming soda beverages.
Regarding school-based policies, implementing a national healthy school policy that mandates regular screening for overweight and obesity could make a great difference. Currently, there is screening for underweight between ages 0 and 5, but expanding this to screen for overweight and expanding beyond age 5, especially in the form of annual or semi-annual checkups in school, would be beneficial and convenient. There are also a number of things that can be done in terms of revising the curriculum to foster healthy habits at a younger age. Currently, there are home economics or cooking classes that are optional for secondary school students, but we feel that teaching younger children how to prepare healthy meals at school could be very effective at forming healthy dietary habits. Part of this can be teaching children how to read and interpret food labels and nutrition data so that they can continue to make healthy choices. Mandatory physical education in schools and having physical movement integrated throughout the day could also be of great help in addressing the lack of exercise. Supplemental education in gardening, caring for livestock, and agribusiness can not only make children more aware of the sources of their food and guide them in making healthier choices, but it can also help prepare them as future agricultural workers. Integrating mental health literacy and well-being into the curriculum, as well as further integrating climate change and its impact across a wide range of sectors, can also have a positive impact on children and society as a whole. In addition, banning the marketing of unhealthy foods in and around schools, as well as ensuring that children have access to healthy foods in schools, is of great importance. We would also like to take steps to avoid the funding of children's resources or sponsoring of school events by corporations that contribute to the marketing and distribution of sugar-sweetened beverages and ultra-processed foods. Mandatory continuing education for healthcare workers would be very beneficial in addressing the evolving landscape of childhood obesity, In addition, we can foster a cultural shift where we emphasize the value of the agricultural workforce, not only via capacity building, but also through the expansion of the agritourism industry and through the support of local farms. Another part of the cultural shift could be expanding the role of the Ministry of Sport, which is currently focused on athletes in competitive sports, to a department that embraces movement for the people of Antigua and Barbuda, especially for children, the elderly, and those in the workforce that would benefit from the support and infrastructure to increase the amount of physical activity in their daily lives. There are also many interdisciplinary approaches to addressing these issues, guiding government policies through the collaboration of different sectors, especially by creating a multi-sectoral NCD commission to facilitate this collaboration would be very beneficial. This would also allow for dedicated funding for multi-sectoral solutions. And we would also want to improve the utilization of data-driven analysis of problems and initiatives, including efforts that are currently underway, as well as new initiatives that are proposed. These initiatives include expansion of policies to protect marine ecosystems, including coral reefs, mangroves, and wetlands, expanding protected areas to secure healthy ecosystems. An example of this is the award-winning project at Wallings, where several acres of land was taken over by the invasive lemongrass species. And there was a great concerted effort to remove the lemongrass and replant indigenous plants, and this is now a protected national park. We would also want to improve the continuous water supply and storage for basic household, business, and agricultural practices. In addition, we could better the management and dissipation of information about expected water availability from rainfall for household water planning. Currently, there are efforts to prevent vector-borne illnesses such as controlling the spread of mosquitoes, but it would be beneficial to also incorporate safe water handling and planning into the environmental health program to better adapt to increasing water stress.
Okay, so we will now discuss a few more regional as well as international level solutions. First, at a regional level, we would like to enhance the ability of our regional bodies to develop adaptation measures for shared issues such as childhood obesity, food security, and climate change. An integration of the University of West Indies expertise on climate change into the childhood obesity topic would also be beneficial. At an international level, there should be a deep revision of all international trade agreements with a focus on keeping protection of our planet while obviously addressing the many interests of our population. Finally, the last key topic moving forward will be combating the lack of data that we currently face when it comes to certain topics such as the ones discussed today. Addressing this will allow us to both measure results as well as set a foundation for future studies to further elaborate the many tools we will use to combat childhood obesity. We must develop research mechanisms to guide positive development of health policy. We must develop monitoring methods that will include a cost and benefits analysis. The goal will be to ensure a positive value is gained from all potential investments and to be very, very careful of private firm dependency on any government support. Finally, we will push for an exchange of knowledge on all of these vital topics in order to ensure a broader understanding of the many factors that mold these issues.
Thank you very much, students. So we've had quite an exciting day. The floor is now open for questions. Perhaps you could raise hands and we'll call on you in sequence. And you could also type questions in the Q&A if you prefer. And I concur with Meryl in the chat, who's congratulating you all on these great presentations. And also, if you have any comments, it may not be that you have a particular question to ask, but if you have some comments, I saw Dr. Lake making some very interesting comments earlier on. Would anyone else like to weigh in?
Can you people hear me?
Yes, we can. Please go ahead.
Hi, yeah, I'm Dr. Alvin Eden, and I've listened with great interest to a really incredibly excellent seminar on the subject that I've spent most of my career working on, having written books about it, etc. And I have been very impressed with the work that the students and the rest of the experts have done, and am struck by how similar the problems in Antigua and Barbados are to ours in the low socioeconomic group of the United States in which I treat. And the problems on the islands are even worse, has been very carefully demonstrated. And while I have this opportunity, I just want to reemphasize some areas that I think are extremely important in reducing the prevalence, to get rid of the epidemic once and for all, beyond all the good things that this seminar talked about. And that is the much earlier intervention and prevention, that the culture needs to understand how dangerous childhood obesity is, starting with the infant. I write books about the first 3 years of a child's life, and that's really when all the returns come in. And we need to start earlier than the way we start in the United States, and I'm sure on the islands as well. And very simple measures can be instituted by parents if they understand the dangers. It's not good at any age to be a lovely fat baby. You're not a lovely fat teenager. And so discussions about sleep, about breastfeeding, about sitting and eating together, about measuring BMI are all easily done. And the culture needs to understand that these factors need to be considered earlier than we usually see them. And finally, a word again about the importance of the high risk child, the risk born to one or both parents who are obese. And I think that's where we need to work hard on. And then we'll start gradually making an input in reducing the epidemic, because the treatment of adolescent and adult obesity is very difficult and usually doesn't work. And I'm sorry to take up all the time, but I wanted to make those points clear. But again, congratulations to the entire organization for setting up this magnificent seminar.
Thank you very much, Dr. Eden. I appreciate your comments. We have a hand raised. Would you unmute and go ahead, please? Means that you're still muted. RC. Okay, until that can be sorted, I have another hand, Saran King. Go ahead, please.
Hello, good afternoon.
Good afternoon.
Can you hear me?
Yes, very perfectly.
All right, Saran King here. I just wanted to know if there are any collaborations with like the Ministry of Agriculture, because Ministry of Agriculture would have their food and security strategic plan. And I was just wondering if there was any collaboration between the Ministry of Health and the Ministry of Agriculture, even just to present the data, because it's really astounding when you see the figures and you hear the effects, especially the economical effects, because economic impact. Is there a way that part of food security can be
You'll be able to
incorporated.
retire on me.
Oh, hello. Oh, sorry. Right.
We're still hearing you, Sarana. Dr. Eden, your mic was unmuted. I think that's what it was.
Oh, okay.
Muted now, so please continue.
Right. So just wondering, as part of the national strategic plan, if anywhere between there, if the Ministry of Health is in collaboration with the Ministry of Agriculture. That's the question.
Thank you for that question. Dr. Walwyn, do you think you would be best placed to address that?
Sure. Good afternoon, Dr. King. Thank you so much for your question. I would really like to believe, in fact, I'm pretty sure that there is collaboration between the two ministries. They share similar concerns. I mean, the main fact that the vast majority of our diseases are nutritional related. But I think the problem is a very deep and expansive one, far more challenging than just these two ministries can handle together alone, which is why we really wanted to put the focus on childhood obesity here. There's so many complex layers to it. And hopefully there'll be far greater collaboration than just what probably already exists, so that we can go further and really reach some of our very important solutions, and others that I'm sure are probably in action right now that we haven't mentioned or that we weren't able to unfold, and others that can come to the table going forward.
Thank you very much, Dr. Walwyn. So we have two questions. There's one in the chat and there's one in the Q&A. I'm not sure which one came first, but I'll give you the one that I saw first. So one person has asked, are school lunch programs available outside of the school year in your programs?
As far as I know, they actually are only functional during the school semester, but I will certainly try and find that out for you, Dr. Rosenkranz. Thanks for your question.
Thank you. And the next question, are parents concerned about their children's obesity, or is it only an issue raised by clinicians?
Gee, looks like I'm answering all the questions. But I think there are times when parents are simply unaware, which is the importance of screening. So parents might think they have a perfectly healthy child. However, it's only when that child actually is weighed and their height is taken and they are appropriately measured. It's not like us as adults where, oh my gosh, I've gained 5 pounds, I'm now 125 rather than 120. With children, as they grow, we do expect them to gain weight, but we want to make sure that it's not excessive weight. As we would have mentioned, there are two ways of going about it, either the WHO methodology or the CDC, but you do want to make sure that you screen your children appropriately. Also check their blood pressures. In the study done in MBS, we recognized that there were many children with elevated weight, high blood pressures. Some of them even we diagnosed with diabetes at the time, and also even non-alcoholic fatty liver disease when blood tests were done on some of the children that we thought were at risk for these conditions. So I do think there needs to be routine screening as indicated in one of our solutions, not just in the 0 to 5, which is done in the Well Child Clinic, but actually throughout the 10 years that the children are formally in education.
Thanks again, Dr. Walwyn. Would anyone else on the panel be comfortable addressing that also? A question about parents versus clinicians being tuned into this.
Carol, can I reemphasize what Leslie just said? There was a large-scale study on first grade, kindergarten and first grade children in the low socioeconomic area of New York, showing exactly what you just said. The obese children, 5, 6 years old, already have elevated cholesterol, triglyceride, high blood pressure. So they're started already on their way to the degenerative diseases that keep the bypass surgeons busy as they become adults. So again, the early intervention is really where we can make important inroads.
Thank you, Dr. Eden. And I'm seeing, so there's someone who has had their hand up for a while. Reducing childhood obesity is the name. I'm not sure if you're able to unmute, please do so and ask your question or make a comment.
Hi, I do have a comment.
Okay, Dr. Lake, go ahead, please.
Yes. This has been a wonderful opportunity to hear a lot of different aspects of this conundrum that we are facing right now in the Twin Island state. And as part of the talk that I've been hearing is, you know, the need to compete for scarce resources. In order to further your cause, you have to come up with the, you know, we're in the era now of evidence and evidence-based medicine. And what we need is the evidence to perhaps convince the powers that be of where these kinds of things should be fitting in the scheme of importance. And so I do know that they have the annual national surveys, or I'm not sure whether they're annual anymore, but I'm just looking at what kind of avenues are there for that are out there right now that we are using or can use or can explore to actually gather this empirical evidence that we need to make these convincing arguments, whether that's research, whether it's in the Department of Public Health, whether that's, you know, things like the national survey, whether it's in school surveys or whatever. Just want to hear some comments and thoughts about that. Thank you.
Thanks, Dr. Lake. Panelists, may I ask someone to volunteer to address that?
I would love Dr. Ramkumar to start, and then I can add in if anything, if that's okay with her.
I'm sorry, because it was, there were a lot of points made. Was there a specific point around agriculture that you
No, got nothing to do with agriculture, nothing to do with agriculture, just in general, like how are we going to collect the evidence to deal with this to convince the people to get the funding or the support or whatever it is to help deal with this problem. It's a multifactorial problem, so.
Right, and I think that was a theme that was just recurrent was the lack of data. I mean, just in my section and in all the other sections. I know that, for instance, they said, I was told that the Ministry of Agriculture now finally has set up an actual unit for statistical units to collect data and analyze data and share data. So I would hope that that would be in every other institution, you know, every other branch of every other ministry, and that it wouldn't then be siloed, that information wouldn't be siloed, but just be continually shared. And I think another problem was the lack of infrastructure, just in terms of in the clinics, you know, to be able, like, do you have a computerized mechanism that you could enter do this data entry? And that was a problem too. So those are the structural things I think that need to be addressed in order to accomplish that goal that you're talking about. But you're right. I mean, you have to go to funders, you have to go to the powers that be with actual data saying, well, here it is, here are the trends, or here's the efficacy of my program.
Well said, Dr. Ramkumar. So we know that there, according to Ms. Samantha Moit, who has really been our source to get information from the Ministry of Health, she's advised us that there is an epidemiologist that has recently started working with the ministry. So that means that we know that a lot of data is gathered. As to what happens to the data is another thing. How well is the data analyzed? And then once analyzed, what steps are made? How much does it actually guide, you know, the analysis actually guide decision-making going forward, so that when there are interventions, we can see the impact and that sort of thing. And certainly, like Dr. Ramkumar said, making sure that we have some evidence of things happening, so that when we go to international funding agencies, they can definitely be supported with specific interventions where they themselves can see, all right, well, we've invested this much, these are the changes that are making. So definitely much room for improvement, and hopefully things are going to stop happening.
Thanks, Dr. Warren. There's a question in the Q&A as we wind down. If COVID happened again, what would Antigua and Barbuda do differently to avoid the social issues discussed earlier? Someone like to help address that?
I think practice makes perfect. I remember from the amount of hurricanes we had in the last 2 decades, Antigua just was able to respond brilliantly after having had some difficult experiences to when we knew a category 5, 4, 3 was even coming. The whole line would have just shut down within hours. I think nobody before had the experience of a pandemic that was alive still. The last pandemic was about 100 years earlier. So this has been a tremendous experience for everyone globally. We're still learning how to respond to the pandemic. So with this information in hand, recognizing what does and doesn't work when you're going forward in a vaccination program, recognizing the deficits that your health system has and how you can actually try and support and improve services and change around that fiscal space to ensure that you still protect the most vital aspects of the economy. These are things that we're all learning about. And so, like I said, we're learning as we go forward.
Okay, so just 2 more. I want to first invite Dr. Brathwaite in case you have any brief comments on that question, if the pandemic happened again from a mental health aspect.
Hi, afternoon again. I certainly think that, as Dr. Walwyn said, the fact that we've been through it before actually gives us a better chance of being able to adapt. One of the things, not only from a mental health standpoint, because one of the things that we did in Barbados was to ensure that we didn't have the disruptions to service delivery for mental health. But what we did have was significant disruption for NCD care services. And we started seeing things like HbA1cs. I think the highest I've seen is 18% in monitoring among my patients who have NCDs. Prior to the pandemic, I didn't even think that was possible. So I think one of the things that we have learned is that, yes, COVID-19 was a challenge, but we certainly could not just divert all resources to dealing with that. Our Prime Minister has a saying, she says that you have to walk and chew. And I think that this time again, we will have, if we are faced with that, we will have to learn to walk and chew. We will have to learn to put some effort towards mitigating the effects of a pandemic, whether it's another SARS type epidemic or some other type of pandemic. But then we also have to make sure that we maintain at least basic services, because we realize that the fallout from NCDs, the fallout from childhood obesity, those things, they don't remain static. And certainly when other stressors are added, they in fact get worse. So that would be my comment with respect to that.
Thank you. So there was a question about legal guidances, and I need to turn over to Dr. Walwyn now to wrap up, but I don't know if, I know we don't have any legal experts in particular on the panel, so I'm not sure if you can make a quick comment about that as you go into your wrap up. There are a couple other questions in the chat, and perhaps our panelists can answer those, in the Q&A, can answer those in writing in the meantime, as we try to ensure that we don't go over time. Dr. Walwyn, over to you.
I didn't see what the question was regarding.
Oh, sorry. Are there any legal guidances about what amounts of sugars and fats, coloring, and fast food quality in Antigua?
I am not sure of any legal guidances. I certainly will explore and try and find the answer for that. I've included my email address in the chat. Please feel free to reach out to me, and I will definitely go to the right authorities to try and find that information for you. But everybody, I'd like to thank you all so much for your participation today. And in particular, I would like to also thank some very, very, very helpful people who made today very possible. Ms. Samantha Moit, who is the Chief Nutrition Officer of the Ministry of Health, Wellness and the Environment, was very helpful in providing data from the health school fairs that we were able to analyze here at AUA and provide the analysis with you today. Mr. Elabanjo, a senior agricultural officer in the Ministry of Agriculture, spent a lot of time speaking with Dr. Ram Kumar and Erin Myers. Mr. Dale Destin of the Meteorological Office of Antigua and Barbuda provided a tremendous amount of information and guidance for us about the impact of climate change in our country. Dr. Elena Villamel for taking the time from her ridiculously busy schedule for helping to analyze our data. Mr. Raman Walwin Venugopal, who provided invaluable technical assistance and assistance with our graphics, especially for our data analysis. Our moderator, Dr. Karen Janes, super busy. She actually took a time out, erased her whole schedule for the afternoon to be our moderator today. To her, we are extremely grateful. The entire AUA team that helped to make today a success, all of the presenters and students today, and of course to you, the general audience, thank you very, very much.